And this is the Friday morning session of the Health and Human Services meeting.
Too much.
What? So we'll be working on 6 bills this morning, and we'll do it in the following order, starting with LD 979. Then we'll consider 81 and 1076 together, and then 972, 1009, and 559. I think that's consistent with the requests we've gotten so far. Okay. And any other requests? We're sorry. So that'll be the order. And we'll be trying to improve the bills in front of us. There won't be any scheduled time for public testimony, but if there's somebody in the waiting room who can materially help us with our work, we'll try and recognize them and invite them in to become a panelist. And you do that by raising your hand. So let's go around the room and introduce ourselves, starting with Representative Griffin.
Good morning. My name is Abigail Griffin. I represent House District 102, which is Glenburn, Levant, and Kenduskeag.
Representative Craven.
Thank you, Mr. Chair. Good morning. I'm Margaret Craven, and I represent House District 59, which is part of Lewiston.
Representative, let's see, who else here? Zach, Representative Perry.
Good morning. I'm Ann Perry. I represent House District 140, which includes the communities of Indian Township, Baileyville, Bering, Calais, Charlotte, Robbinston, Perry, Pembroke, and Pleasant Point.
Representative Stover.
Good morning. My name is Holly Stover. I represent House District 89, including the towns of Boothbay Harbor, Southport, Edgecombe, Westport Island, and part of Southport.
Senator Moore.
Good morning. I'm Marianne Moore, and I represent Senate District 6, which is all of Washington County, as well as Goldsboro, Winter Harbor, and Sullivan in Hancock County as well.
And Representative Meyer.
Good morning, and thank you for joining us here today. I'm Representative Michelle Meyer, serving Southern Maine's House District 2, which is all of Elliott and parts of Kittery and South Berwick.
Representative Madigan has just joined us.
Good morning. I'm Colleen Madigan. I represent House District 110, which is part of Waterville and part of Oakland.
And I'm Ned Claxton. I represent Senate District 20, which consists of Auburn, Minot, Mechanic Falls, Poland, and New Gloucester. So let's begin with 979. After we introduce our staff that keeps us together. Ms. Dooling.
Good morning. My name is Erin Dooling. I'm one of the legislative analysts with the Nonpartisan Office of Policy and Legal Analysis.
And Ms. Withy.
Good morning. My name is Carrie Withy, and I'm the clerk for the Health and Human Services Committee.
Okay, so we'll go ahead and start with 979.
LD 979 is an act to expand Maine's school-based health centers. The bill provides ongoing funding of $600,000 annually from the Fund for a Healthy Maine for DHHS to distribute through an RFP process to expand the number of school-based health center sites. The initiative language directs the department to give priority to proposals that demonstrate, a commitment to closing existing health disparities based on race, ethnicity, or tribal status. You heard in the public testimony that the Maine Primary Care Association was suggesting making adjustments to the reporting requirements required of school-based health centers, and you should have received some information from the sponsor and the association yesterday evening. You also had some questions surrounding minor consent in school-based health centers. Elizabeth Jackson from Greater Portland Health provided some information based on that one school-based health centers approach that was sent to you in an email as well. I'm happy to go over that if you have more questions. And the fiscal impact statement shows $600,000 of Fund for Healthy Maine money beginning in fiscal year 2021.
So are there questions from the committee based on Erin's analysis report? Is this the language of the bill we passed last year unanimously, Aaron? Is this roughly the
You
same?
know, I
language?
don't know. I don't know if it's identical or not.
Okay, I see
I
a
know
couple
that there
heads.
was a bill about funding, but I don't know if the RFP priority language is the same. I can't,
Okay,
I just don't know.
okay. All right, but it's similar. Okay, we're also, yes, Senator Moore.
Actually, the bill that we passed last time wasn't to provide ongoing funding for the additional 15 the existing
Mhm.
15 school-based health centers. The bill that we had that was expanding it to 15 more did not pass.
Okay, okay.
And that's
Thank
why,
you.
so this is a little bit different because this is actually talking about doing the RFP, just like we did at the beginning of the initial 15 programs.
The initial process. Okay, thank you,
Exactly.
Senator Moore. So we can now go to bill sponsor. Welcome, Representative Sachs.
Good morning, everyone, which I understand for your committee is just a continuation of last night into this morning.
Today is
Good morning,
Blur's
everyone.
Day.
Yes, Blur's Day for sure. Thank you for having me this morning. I just did want to clarify that the bulk of the language of this bill is exactly as 836, other than the recommendation by the Permanent Commission regarding the RFP process. And that was vetted through quite a esteemed committee of folks on the Permanent Commission recommending that language. And Senator Moore is correct. This, of course, unfortunately had died due to the adjournment of 836. The prior bill of 129th did die just because of inaction due to ending the session.
Okay. So there were a couple of questions raised. One was about the consent process. Does anybody want to touch that with a potential amendment? The question was raised by our colleague about whether we could standardize that in some way or make it any less onerous, less complicated than it is. Representative Perry. When you're unmuted, there we go.
Yeah. My question is, we're talking about expansion, and the request about permission slips really belongs to the whole program. Does it really belong in this legislation?
Okay. I haven't seen anybody else who wants to step up and offer amendment related to the consent process. So I think the committee generally agrees with your thinking, Representative Perry. How about reporting requirements? That was raised. Representative Griffin.
I still have a problem with the parents not being notified of when they go to the health center, especially when it has to do with counseling for and being educated for sex, sexual issues. I'm still having trouble with that. So right now, to be honest, I'm ought not to pass, but I guess if something can be changed, then I don't know.
Okay. Okay, Representative Sachs.
I did want to note that there are several attendees in the waiting room if you'd like to talk with somebody who is talking about how this works for folks. But again, it's for the consent form, it's the standard form, and this is standardized. There was no amendment about wanting to change that per se, but that this is a standard permission to say if you'd like to access the health center at the beginning of the year, that the parents know what's at they take it upon themselves to know the scope of the services, which are not the same within every school-based health center, but they do sign a permission slip. So I just wanted to clarify that piece.
And do you know, is that done every, I'm sorry, should have asked.
No, go ahead, Representative Griffin.
Is that done every year? So parents, in case for some reason they change their mind, for whatever reason. So that's
absolutely, yes. As a parent who's had to do those forms annually saying, why can't you just do this thing that's the same information? Yes, they do, ma'am. Thank you. Good question.
And that permission auto expires at some point. Yeah. Okay.
Yeah.
Does that address your, some of your concerns, Representative Griffin? Your questions?
Because I just want to make sure that parents have a say for what's going on with their child, you know, for whatever reason, that they're notified and, you know, they have all the information. So.
I support that idea. Yes, Aaron?
I just wanted to direct your attention to the information that was emailed about the annual consent forms from Elizabeth Jackson last night. But I also wanted to clarify that school-based health centers and their possible confidential treatment of minors isn't unique to school-based health centers. Those are laws that exist across health providers generally. And so that's not anything that's being directed to be changed by the bill. But for example, you're correct, family planning services are not something that requires parental consent. But those are the laws generally. That's not unique to school-based health centers.
So in this case, it's actually somewhat more stringent in that every year you can change that access to school-based health center. Okay.
I don't know. You should, if you have follow-up questions, you should look for somebody involved in the centers, because that's not how I read Ms. Jackson's email.
Representative Perry?
Yeah, I just want to, having worked in a school-based health clinic, I will say that we do get parental consent at the beginning of the year, but the other thing is many times parents will ask their child to be seen because they're working. It gives them the ability to keep the child in school, not have to take time off from work. And usually too, once I've seen the child, I call the parent with the child in the room so both know what's going on. The communication with the parent is very open, and as open as we can make it. You know, and yes, there are times when we have to have the child's permission to do that. But beyond that, the communication is pretty open.
Representative Sachs.
My apologies. I will take my hand down and have more coffee. Thank you.
Now you're making me jealous. Representative Madigan.
Thank you, Mr. Chair. I just want to add that having worked in a school-based health center, Representative Perry is exactly right. They work with parents. Any other referrals? For instance, I worked as a mental health provider in those, and that was a separate referral, and I would still have to get consent for that to start treatment. And they worked as a team and worked with parents, and most parents found it pretty convenient. If their child needed a strep test or needed, you know, something looked at, they could get it done at school rather than miss school, rather than the parent miss work. And kids saw the providers in their school every day, so they were pretty comfortable with them. It's a great model.
Okay. I don't see any other questions specific to that. The other issue was raised about reporting requirements. And there was some interest in easing those a little bit from the Maine Primary Care Association. Does that ring any bells for anybody? Representative Sachs, I saw you nodding your head.
Yeah, and Brian Wyatt is in the waiting room. He is the person from Maine Primary Care Association, so he's happy to answer any questions regarding their request.
He is on his way. There he is. Welcome, Mr. Wyatt.
Good morning, Chairman Claxton. Thank you. I appreciate the opportunity to put a little bit of context to the testimony that we submitted, and I appreciate Representative Sachs for working with us and hearing us actually since prior to the public hearing. So school-based health centers really do drive part of the mission that we have as a health center, and that's expanding access, and we fully support this program. What we are hearing from our health centers that are currently in the program, have been a participant in the program, or have been thinking about becoming a program participant, is their concerns over the reporting requirements. There's a number of those requirements, and I believe they've been shared with the committee, dealing with RASPs, some of the export variable data that's required. And what we're hearing is with respect to RAPs in particular is, really this was a more widely used pediatric assessment 10 years ago, but it's not as widely used now. It's also duplicative of some of the other standards and best practices that FQHCs adhere to. So it's really difficult for some of the care teams, the time-consuming processes. I mean, it's interesting, since I've been at the PCA, the two most concerns that health centers have are workforce and the reporting requirements across all their various programs. So they had really two recommendations. One was, would it be possible to remove the requirement of the RASP survey? And could we convene a group of participating school-based health center providers who could really hone in on what the recommended data variables that would be relevant, meaningful, and easily extractable from EMRs? Because right now, a lot of the work is being done with Excel spreadsheets. They're manually updating things. And as you can imagine, that's, it's time consuming and ripe for mistakes, quite honestly.
Thank you for that information, Brian. Are there any comments in response to that? Representative Perry.
Sorry to do this again. I mean, I understand the issue around it. I also found the RAPs very helpful because that created a great conversation with my patients and an ability to focus on areas you wouldn't normally focus on. So the only thing I would recommend is that there be some work with HHS because it's also good collection in terms of what the issues are around developing something that might be more user-friendly. But being a provider and working with the children in the clinic, I found that a great way to really assess how well a child is doing and where they are at that time.
Are you proposing a work group with a report back and the option to write legislation?
Actually, I think that's rulemaking.
Yeah.
I really think that's really about rulemaking, and maybe we can request that they talk with that there be something of communication with the school-based health clinics to see what might be workable. But I don't think that we need to have legislation to change that.
Okay, Brian?
Yeah, and Representative Perry, thank you for that. One of my notes that I failed to mention was the fact that, the whole RASP, there's a it's a two-sided coin. On the one side, there are many, nurses, et cetera, doctors that really appreciate the elements of that. It does get the conversations going with the patients. So that's really important. So I appreciate you highlighting that. And, we do agree that we think this is really more of an administrative issue. And part of it might be as simple as what we've learned in the surveying of our members is those who are currently participating in the program are essentially operating under extensions of the RFP that they filed 10 years ago. So it may be, and they are being told that at some point in the future, there's going to be a new RFP with perhaps new requirements, new directives. And, it may be as simple as how many of us are driving a 10-year-old car? Technologies change, safety features change. And, it might just be a function of focusing on that new RFP.
And not a place for legislation or statute. Yes, but are there ways that we could encourage this to happen? Maybe write a letter to the school-based health system and DHHS asking them to review standard operating procedures, looking for efficiencies for the provider and value for the patients they see. And then letting us know what rule changes they're considering and if there's a role for legislation. How would that sound to you, Brian?
That would be great. Yes.
Representative Sachs?
And I wanted to just state that the fact that this is, if this legislation passes, what a great time to be having that conversation, because a new round of RFPs would be going out. So there's some elegance and synergy in that as well.
And somebody will have to be crafting that RFP, and it seems like the people who are crafting the RFP are the ones to address the other concerns sitting at the same table at the same time. Just saying.
Right, the main CDC, I understand that the main CDC is the operating arm for the RFP. So it would be great to connect these folks together.
So is that enough direction in terms of crafting a letter, Erin?
I think so. I'm just confused. I don't think there's a school-based health system. I think each school operates their own, or I think they're kind of individually based. So do you have another sense of, I can send it to the CDC, but do you know who else we should include on the letter that should go to?
Is there some sort of consortium that they partner with or partner as? We don't know. So, well, that would be 15 letters plus CDC. Yes, Representative Sachs?
I'm sorry, trying again, more coffee needed. So sorry. That the George Shaler, who had testified here, does meet with a consortium of school-based health centers. I don't know how often they meet, but he definitely would be somebody that we'd want to send that to for, again, I believe it's a monthly meeting of school-based health center, existing school-based health centers.
Yeah, if we can piggyback on something that already exists and
does.
build off of that, that sounds like a better way to go.
Yeah, I believe that would be a great way to go. And
Okay.
Erin, I can certainly, Ms. Dooling, I can give you that information, although I believe he submitted testimony and he testified here during the public hearing.
Thank you.
Does that give you enough to work with now, Erin? Okay, great. All right, so I don't see any other questions or concerns. Then I'll entertain a motion.
I'll make that
Representative
motion.
Craven?
I move we ought to pass as amended.
I'll second that.
So the motion has been made and seconded. Is there any additional discussion of LD 979?
Is the amendment just the fiscal note or
Yes.
what? Yeah.
The amendment's the fiscal note, right, Representative Craven? Yes. Okay. And is there any other discussion? Yes, for Senator Moore.
Do we need to include in that motion the request for the letter to the department? No.
No, I don't
Okay.
think so.
Thank you, Erin. Okay, wasn't sure. Just thought.
Yep. Any other questions, concerns? So it's Ms. Withy's turn to run the roll for voting. Before you do that, let's give Representative Lemlin a chance to introduce himself.
Good morning, I'm Michael Lemlin. I represent District 88, Chelsea, Jefferson, Whitefield, and half of Noblesboro.
Okay, Ms. Withy.
Representative Zager. Representative Zager is absent. Representative Lemlin.
Yes.
Representative Lemlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci. Senator Baldacci is absent. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Connor. Representative Connor is absent. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Javner. Representative Javner is absent. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 9 yes, 4 absent.
Thank you for that. All right. Thank you, Representative Sachs, for bringing this forward. And it'll be interesting to see how it proceeds from here. Glad you could join us.
Thank you so much. Have a wonderful day.
You too. And okay, so now we're going to go to consideration of LD 81 and LD 1076 since they're so closely related. And we'll hear from Erin about her analysis.
Okay, just going to share my screen again. So both of these bills were similar, so I kept them on one bill analysis. LD 81 and LD 1076 both address youth shelters in Maine, and they have a couple of different pieces to them. For shelters for homeless children, LD 81 would extend the allowable consecutive overnights from 30 to 60 days, and that is done by amending the definition of shelters for homeless children. Similarly, it proposes the same extension for emergency children's shelters by extending amending the definition of that term. 1076 also addresses the definitions provisions, except that it proposes instead of 30 days to 90 days, both for shelters for homeless children and emergency children's shelters. 1076 also directs the department to amend its rules regarding notification and consent requirements for guardians of children entering the shelter. So for shelters for homeless children, it directs the department to allow admission for up to 30 days without first notifying the child's guardian. And for emergency children's shelters, it directs the department to amend its rules to allow admission of children for also up to 30 days without the permission of the guardian. Finally, 1076 also proposes to increase the funding provided to homeless youth shelters from $2 million of general fund annually to $2.5 million annually. You have a preliminary fiscal impact statement on LD 81 showing no fiscal impact. The item one, the preliminary fiscal impact statement on 1076 hasn't been determined yet.
But it's a pretty safe bet. It should be about $500,000.
So in terms of drafting issues, DHHS's rules in chapters 8 and 9, which are the chapters that deal with youth homeless shelters and emergency shelters, would need to be updated as well to reflect the statutory changes proposed in either of the bills, the amendment of those definitions from 30 days to either 60 or 90 days, depending on what the committee decides. So I would recommend a directive to the department to update its rules so that those rules are consistent with the statutory changes. I also had a question about the funding piece because it currently says homeless youth shelters is what the funding would be applicable for. And so I think the intent is that it would be applying for shelters licensed under both chapters 8 and 9. But I think to be perfectly clear about which facilities those are available for, I would recommend cross-referencing those DHHS rule chapters. You also had a number of information requests that you received a memo about from DHHS and also a memo from New Beginnings from Chris Bicknell particularly in terms of the length of stay of unaccompanied youth and occupancy rates. You had asked whether 60 or 90 days was the preferred, the optimal period of time. I wasn't able to determine that in my research, but I think Mr. Bicknell has provided that information in his memo to you. And also Luke and I had some additional questions that we asked of the department relating to the RFP that the department mentioned in its testimony. It appears that those shelters those facilities that are licensed under chapters 8 and 9 are currently operating under an RFP. And so we would probably be looking, and that the pending RFP is a continuation of those underlying contracts. And so we would be looking for a little bit of clarity about how the committee would direct the additional funding in light of the pending RFP. And then for your information and reference, as the discussion continues today, I've provided the rules on notification and consent of guardians for admission procedures under both licensing chapters, and a link to the RFP that the department mentioned in its written testimony. And I think that the department has somebody available to help answer any questions you might have, and I'm sure the sponsor and other people might be available as well.
So my proposal is we go through these things step by step. One of the questions that was out there was what the intent was for the dollars. So I see the bill sponsor here, and we'll ask Senator Livy to help us understand if he had significant designs on where that money was going.
My significant design is that new money goes to the 3 shelters for their operations. I don't mean to be flip. I noted in my testimony that they've been flat funded since 2005, and in consideration of inflation, annual appropriation from the state would have grown from 2 million, which is the current amount, to 2.7. My proposal is bumping that number up to 2.5, and that those funds would be available for distribution to the 3 shelters. I'm not an expert on the department's RFP process. I defer to the operators and the department on how that money would flow.
Okay. All right. Let's go with sorting out where the money goes. Maybe Director Landry can help us understand how that money might best be used or would be directed. Welcome, sir.
Thank you. As we indicated in our response to the committee, we'd be looking forward to the committee and the legislature for their intent. As we indicated in our letter on 1076, we believe the RFP should guide those funding determinations.
And is the RFP process specific to emergency shelters or homeless shelters?
The RFP, I believe, is for both.
Okay. All right. And if that's the case, would that meet the intent that you're looking for, Senator Livy?
I think it's unclear, and the committee may want to hear from Chris Bicknell, who's one of the operators.
Yep.
The RFP is going to expand their scope of work, and so it's a question they might be better able to answer.
There's Mr. Bicknell. I couldn't figure out where you went. You put your hand up and then moves you around from where I was normally looking for you. Welcome, sir.
Thank you. The RFP does not have a specific dollar amount attached to it. So the providers who are applying for those funds do not know whether or not we're applying for what existed in the previous budget or if there's an expanded amount. We do know that there's a significant requirement to expand the scope of services with the RFP. So there's an assumption that there is more funding available, but we are unaware of the available dollar amount for that RFP.
And Director Landry, my assumption is that 600, should it pass, would get rolled into the resources that you have that you could commit to homeless shelters and to homeless and emergency shelters based on an RFP process.
I'm sorry, Senator Claxton, did you say 600?
I'm sorry, 500. Yeah, 500. Sorry. Yeah. I'm back on the other bill. Don't just ignore me.
That would be my assumption, Senator. Yes.
Okay. And are there constraints on the RFP in terms of the amount of dollars asked for? Is there a minimum or a maximum?
Unfortunately, state procurement laws and rules do not allow me to be able to talk about an RFP while it's in progress. While it's in process, excuse me.
So that means it's already been drawn up and it's out there for consideration.
That is correct. It has been released and is open. It's in the RFP period for bidders to consider and to respond to.
Okay. So then I would assume that you would then, if the RFPs met the standard that you're looking for, that you'd finance based on the pool of dollars available. And this additional 500 would allow you to go further on the list if everybody met the standard. Is that
My
general enough?
apologies, but again, I really can't talk about the RFP while it's in
Okay.
process, as I understand the state procurement rules.
Okay. Yes, Aaron.
If that's the committee's intent, you can clarify that in the initiative language. It sounds like everybody's looking for that, some kind of clarification around that.
Okay.
But we can draft that.
Okay. No, I wasn't trying to paint you in a corner, Director Landry. I was just trying to understand, and I appreciate the answer. Are there additional questions about the dollars? So okay. So is everybody comfortable that the dollars will be rolled into the available resources that we distributed based on an RFP system that's already in place? I see some head nods. Okay. So only 7 more issues to address on these 2 bills. So the next one I'd like to go to is the duration, the difference between 60 and 90 in both bills. And I'd like to hear, can somebody speak to the average length of stay as it exists now? Was that something we'd have talked about before, I think, Director Landry?
Yes, Senator Claxton, I'm happy to explain it. We've attempted to explain it a couple of ways in our memo that hopefully might be useful if I walk you through very briefly. Before I do that, regarding the RFP, I will tell you that proposals are due to the department on May 3rd, 2021. Regarding the length of stay, we provided different amounts of information for you to consider. First, I do want to point out in the answer to the first question that we received on occupancy rates, the information that we provided you is based on 2020 data. And so, I'm sorry, it's a past 12-month. The 12-month occupancy rates are shown there for your information. So this would be for the last, the 12-month period that we have data on that shelters are required to enter into the HMIS system. Regarding the length of stay, we looked at the same HMIS information that providers are required to enter information into. So I do want to point out in the middle of the second page, what you see there are 2 different ways to look at the average length of stay. I'll start from the bottom up. When we look at each youth's individual length of stay, regardless of how many times they may have come in or out of the shelter, you can see that the average length of stay on those individual occasions were 20 nights for New Beginnings, 6 nights for Shaw House, and 7 nights for Preble Street. The previous bullet point in the middle of that second page indicates when you add up the total non-consecutive but cumulative nights of stay, because some youth obviously, as indicated in the answer to one of the prior questions, may come to stay, they may leave, they may come back, sometimes on multiple occasions. Even when you take into account the cumulative non-consecutive average length of stay, you can see that those range from 23 nights for New Beginnings to 44 nights for Preble Street, with Shaw House in the middle at 36 nights. The last thing that I will point out that is not in our memo, but I was able to confirm this morning, the governor's executive order extending the consecutive number of nights from 30 to 60 was issued on April 27th of 2020. So just under 1 year ago. I was able to confirm since April 27th of 2020, when that executive order was issued, the department has received zero requests for any extensions beyond the 60 days. Hopefully that helps to answer some of the questions that you have.
Thank you for that. Are there questions of the, yes, Senator Libby?
Mr. Chair, we were a bit confused when we heard Dr. Landry reference the 60 days in the executive order. We reviewed the executive order, and our understanding is there was a 30-day limit in place prior to the pandemic. The executive order lifted the limit entirely, and that's the cause for no requests. And Chris Bicknell can correct me if I've misstated any of that.
Mr. Bicknell?
That is correct, that there is no time limit in the executive order referenced by Dr. Landry. And so no requests have been made as a result of that unlimited time of stay. The only limit in the executive order is based on age. So if a young person reaches the age of 22, then their time at these shelters is up.
And to be clear, we're talking about the 3 emergency shelters with these numbers, not the homeless shelters. Okay. All right. So are there additional questions about length of stay? We've been joined by Senator Baldacci. Did you want to introduce yourself, sir? When you're unmuted.
Good morning, I'm Joe Baldacci and represent State Senate District 9, which is the city of Bangor and the town of Herman. Thank you.
So we're paying attention right now to the length of stay issue around the emergency shelters and trying to get some clarity about whether we need to go with the department's recommendation of 60 days or the bill's recommendation for 90 days. Are there additional questions about this piece? I don't see any for right now. Yes, Senator Baldacci.
I just want to indicate that I support the Senator Libby's bill. I think the 90 days makes sense in the long term. One of the issues we need to talk about at some point, I don't know, is about
it's on the list.
It's on the list. Okay.
It's on the list.
Otherwise, I want to look at those issues that we talked about. Otherwise, I'm good with the 90 days.
Yeah. Okay. So it's on the list. And so we've answered those questions. Are there any questions for folks around length of stay in the homeless shelters, 60 versus 90? Or have we addressed that, even though we don't have data? Mr. Bicknell, can you speak to how long folks stay in the homeless portion of your work? The homeless shelter portion?
Yes, so in the information I submitted yesterday, we had data from Preble Street because they have an electronic client record. We're able to pull data from last year pretty readily. The other 2 shelters do not have electronic client records, so we didn't have the time to dig through the paper records. But what it shows is that in the past year, 32.25% of youth staying at Preble Street's shelter stayed 50 nights or more. And so that's a little over a third of the young people who stayed at that shelter require to stay longer than 50 days. And most of those were between 50 and 100. 8 of those were over 100 days.
And we'll come back to this topic and not to be discussed now, but do those extensions beyond the 30 days require permission on a daily basis in the homeless shelters?
Currently, no, because of the executive order. When the executive order is rescinded or lifted, then yes.
You go back to daily. Okay. Director Landry?
Yeah, thank you very much. I do want to be clear that it's not my understanding that anything is done unless it's requested by the shelters on a daily basis.
Mm-hmm. Okay. And we'll come back to that issue because I had some thoughts about that. But
yeah.
let's
and then and I'm sorry if I may,
Go
I
ahead.
I would just point out that, and again, the data speaks for itself, I believe, is that even when there was no limit, as pointed out by the colleagues on this call, the average length of stay was certainly considerably less than 60 for the past year.
Yes. Yeah. Okay. So are there questions around length of stay in homeless shelters that need to be addressed for the committee? Okay. And then there's the additional, okay, so as long as I just raised the issue, would the department be open to making applications for extension? This is not in either of the bills. For continued stay, something like 10 days, so that it wasn't an everyday process?
Well, again, it's not an everyday process unless it's at the request of the provider. The current, according to our children's licensing data, generally speaking, in the past, pre-executive order, those extensions were provided for a 30-day period unless requested differently by the provider.
Oh, that doesn't sound like what I heard. Mr. Bignell?
Yeah, so it's actually pretty unclear. I think each provider has interpreted the regulations differently and made different types of requests from the department for extensions of stay. And so having something in the actual licensing rules or in statute that was very clear would be extremely helpful to the providers so that we're all operating from the same place.
Okay. Yeah, so yes, Representing Director Landry.
I would just simply say that from our view, that it does, that if there is going to be a requirement put in place, it should be customized and individualized for the need of the youth and their situation versus any flat absolute. And so that is something that I would just mention since this hasn't been discussed previously.
Okay, so maybe we shouldn't go there because there's some work to be done around that issue. So I also want to come back next to the issue of notification, and I want to try and keep it away from permission. Let's talk about notification for right now. And in 1076, there is a provision for emergency shelters that, I'm confusing it again. Okay, so in Chapter 8 related to homeless shelters, you have up to 30 days for notification. Is that what I understand of the bill, Senator Libby? Maybe you could put up your graph again.
I just want to know for the committee, I did not speak very clearly on this point during the public hearing, and that Chris Bicknell, following me, did help clarify things. So I direct questions to Chris.
So if you could share your screen again, Aaron, I want to make sure we have the language correct around Chapter 8 and homeless shelters.
Do you want the rules up, or do you want the?
Let's start with the graphic. There we go. Thank you. All right, so we're on the left 3 columns, and we're trying to sort out the lower right box says allows admission for up to 30 days without first notification of the child's guardian. That apparently is part of Senator Libby's bill, but we understand that Chris Bicknell can speak to that. Go ahead, sir.
So I actually don't believe that that is part of the bill. I think there was confusion in the initial testimony. The only thing that is included in the bill is the lower right hand, allowing admission of children for up to 30 days without permission of their parents. Notification is required by statute. I believe we have to begin that process within 3 hours of a young person arriving, and we don't stop until we have actually notified the parent guardian, or if we fail to get a response, we are required to notify the department as as well. And so we're only asking for permission because there is significant family conflict often with those children entering the system.
So again, I want to be clear. We're just trying to stick to those left 3 columns. You've used the word permission, and that's not interchangeable with notification.
Correct. We are not asking for a change in the rules around notification.
Right. Okay. So that addresses a significant gap. Senator Moore.
Well, I'm just pointing out, and I know Aaron strove that too, that section 3, that's what it's talking about. Up to 30 days without first notifying the child's guardian.
Right.
And then
That's what I'm
section
trying to
4 is
add.
the permission, yeah,
Yeah, no, that's what I'm trying to get at, because there's
Okay.
significant concerns about that
right.
that I've heard from the committee members.
That was not our intent to have it be notification. It was permission is what our intent.
Okay. So under the current circumstances, if we just strike that language, it reverts to what the current circumstances are, 3 hours on the homeless shelters for notification of guardian. Okay. Is that what you were going to say, Senator Representative Perry? Okay. All right. So that box should be crossed out, and we shouldn't try and improve something that's already okay, is my read. Okay. All right. And then that gets us to the lower right-hand box of the total graph, which is up to 30 days without the permission of the child's guardian. This, and it's specific to emergency shelters. So my questions are, does the 3-day or the 3-hour notice to somebody apply in the emergency children's shelters rules? Mr. Bicknell?
Yes, I believe it applies across all shelters.
Okay, so we can take the whole issue of notification off the table because somebody knows. The one proviso that's been raised in the conversations that I've been privy to is that there's concern that notification might put the shelter or the child at risk if a parent, if a child seeking emergency shelter, if their parent was notified directly. How does that notification process work now?
If a young person shows up and says that they are at risk of harm from their parent or legal guardian, if they are notified where they are, we immediately contact Child Protective Services.
Okay, and not the guardian.
Correct.
Okay, there was some question about how that process went. Representative Perry?
And my question now, as we go back to the shelters for the homeless, from what I understand and what I'm hearing is that instead of striking that, the error was that they put in notifying instead of permission. Am I correct that you want permission to go for both the emergency shelter and the homeless shelter?
We haven't
Correct.
gotten to that. Was that yes?
Yes,
Senator?
I believe that was just a substitution of a word that was inadvertent.
Okay, that's what I'm understanding. So
okay, that
what
helps.
we want to do is to strike notifying or put the same wording in
Okay,
section 8 or 9, I can't remember which one that is.
Okay.
Section 2, and as is in section 4.
okay, thank you. That helps,
Correct.
Representative Perry. Okay, now I understand the intent better. All right. Okay. Okay, so in an emergency, so in both circumstances, the child can stay where they are without the permission of the parent for up to 30 days. At which point you initiate the process of trying to get permission. Is that right?
I would say we would initiate the process of trying to get permission immediately as well. But there are circumstances in which parents are extremely hesitant to give permission, and relationship building needs to happen in order to get that permission. Specifically when children arrive who are in extreme family conflict,
Sure.
and there is fear that giving permission to stay at the shelter will result in a child protective case being open, or that they will not be included in the process, or that the intent is to somehow remove the child from their custody. And so there's a lot of fear from families who are in this place that of unknowns. And this extension gives us an opportunity to work with families to alleviate their fears and let them know that the sole intent is to return them to a safe home.
Okay. Yes, Ms. Dooling.
I guess I would be looking, if you're inclined to direct the change in Chapter 8 to apply for permission of the parent or the guardian, I'd be looking to work with the department or somebody, because the word permission doesn't appear in Chapter 8 like it appears in Chapter 9. Chapter 8 only addresses notification of the guardian. The only time it mentions consent has to do with fundraising or research for or publicity for the facility. So I'm not clear what is proposed to be changed, or if this is a new directive under Chapter 8 specifically.
Okay. Dr. Landry, does that create different work or impact the department in some way that we're not anticipating?
Yeah, I do. Thank you, Senator Claxton. I want to be clear. I was just looking through all of the details again, and maybe Ms. Dooling can put it back up on screen if needed. When we're talking about Chapter 9, which are the emergency shelters, there is no notification piece in Chapter 9, because it was assumed that the consent piece also served as the notification, is the way I'm interpreting that. So I want to be clear, absent the consent piece, there is no notification requirement in Chapter 9 for the emergency shelters. Ms. Dooling, you can confirm that if you wish, based on the research you've done.
I think that that's correct. The two chapters use different terms. Chapter 8 only talks about notification, and Chapter 9 only talks about consent.
Thank you, Ms. Dooling. I will say that is because of our interpretation of the different types of services being provided in the two different chapters. And because of the services that are required in Chapter 9, that is where we believe there needed to be consent, as opposed to simply notification in Chapter 8.
Okay. And in Chapter 9, is there a notification process in place independent of the consent conversation?
Currently, no.
Does the department, Representative
Sorry.
Dooling? Aaron,
Sorry.
go ahead.
Attorney Dooling, not representative.
Yes, I know, I know.
There's a notification of the department requirement under Chapter 9, but not a notification of the guardian requirement. So it's important to distinguish who we're notifying, or who, yeah.
Understood. And I just want to make sure there was some notification process in place so that somehow the guardian knows the kids at least in a safe place. That was a concern we've heard along the way in our conversation. So that's because we don't have a look into the rules right now. I know we're way into the weeds in a bit, but I want to make sure we don't make things more complicated than they need to be. There is already a notification process in place for emergency shelters. The issue is whether we extend the permission work up to 30 days. Director Landry?
Again, there is not a notification piece for emergency shelters. There's only the consent piece. The notification piece is in Chapter 8.
And I was using the term notification to be inclusive of the department. That's a form of, I'm talking about how do we get the information to a guardian that a kid's safe?
Correct. The notification is to the department. It's not to the parent or legal guardian.
Which is fine, as I understand the concerns of the committee. That addresses that whole notification issue. Because it then becomes the department's responsibility to decide to contact the parents or not, or when that best happens. Is that right?
We believe that it is still necessary for the parents to be notified by the emergency shelter.
And a current time frame for doing that?
The current time frame to do that is assumed to be built into the choosing or attaining the consent of the guardian, which is within the first 12 hours of care.
Okay. So a kid in an unstable circumstance goes to an emergency shelter. The department knows within a few hours, and the facility then has to try and contact the parent, or does DHS contact the parent, the guardian?
It depends. If they are notifying us because of an issue of safety, et cetera, then the department certainly will take a leadership role in that. If there's not one of those issues, then the 12-hour consent has to be done by the emergency shelter.
Okay, so I'll go back to the bill sponsor before we go back to Mr. Bicknell. And does that, so apparently the 12 hours wasn't felt to be long enough when this language was drafted?
Yeah, this is where it gets challenging because New Beginnings is licensed one way, and Preble Street and Shaw House are licensed a separate way. So I don't know if we have folks from Preble Street or Shaw House watching, if they could raise their hand, and Chris and one of the others could help walk the committee through this, because I honestly need a grid to be able to follow this conversation. It's getting a little unwieldy for me. We're quite in the weeds.
I know. And so anybody in the committee got questions that need answering at this point? Right now, we're talking about the effort to get permission starting between 12 hours as it exists now and up to 30 days, which is what's proposed in the legislation. Representative Perry.
I guess my question is the rationale for 12 hours and the rationale. I understand the rationale for 30 days, but what's the rationale for 12 hours with it being such a short period of time for consent?
That sounds like a question to you, Dr. Landry.
I'll be happy to try to address that to the question. The issue is the type of services that are being provided. In the case of the homeless shelters, for example, in the case of those homeless shelters, generally what happens is the youth stay overnight and then they, in many cases, leave in order to go into the shelter's day program. It's not a treatment approach. In the case of emergency shelters, they are providing 24-hour care, and the children or youth receive services like in a crisis situation. So it's treated as if it's a consent to treatment, using that analogy from a medical perspective. Those services could include crisis intervention support by assisting the youth with problem solving and potentially even engaging the efforts of a crisis provider. It could include mental health, substance use, sexual identity support. It could include case planning that could involve mediation, for example, with family members aimed at resolving situations. So it involves a different level of service versus a homeless shelter, which is the previous chapter, chapter 8, which is why the two are licensed differently and have different rules.
Does that answer your question, Representative Perry?
A little bit.
A little bit. Okay.
A little bit.
Now, Chris Bicknell, yes.
Yes, so I'm glad Dr. Landry mentioned the analogy with medical consent. In the 129th legislature, a bill was passed reducing the length of time for medical consent for juveniles experiencing homelessness from 60 days to 0 days. And so the legislature has put into statute medical consent for juveniles experiencing homelessness as immediate. They can consent to their own treatment without parental consent. And we view the services at the emergency shelters the same as medical consent. They are consenting to treatment to treat their homelessness. And so we would agree with Dr. Landry in that analogy, but view the goal differently.
Before we go back to Dr. Landry, can we go back to Mr. Bicknell just a minute? So when, in the circumstances of your work as an emergency shelter, would you contact the guardian for permission to treat?
We would begin that process when we were seeking consent to, when we were seeking notification, right? We would always start there because our absolute goal is to return a young person home as soon as possible with the cooperation and participation of the family of origin or the guardian that they had been staying with. And so that is our primary driving force for any young person who comes in. And we begin that process. But as I've said before, we often meet with a sense of fear from the family or guardian that is going to lead to a negative outcome for their family or their child. And so we just need some time to build that relationship and trust.
So it sounds like there's potentially different tracks for different level of risk for the people coming to the emergency shelter. All right. Representative Perry.
Sorry, but
No, don't
yes,
apologize.
my question is because the need for consent, especially for treatment, I think is significant. I think 30 days is too long. First of all, you put your providers in jeopardy on that one as well. Now, 12 hours, I think, is a bit short if you want time to help them understand what's being offered. And if you got somebody who comes in at 10 o'clock at night, well, 10 o'clock in the morning, you have to have the consent. That sort of leaves things at a loss. You know, to lengthen that to maybe 48 hours would give time, I think, to educate the guardian about what the services are in the shelter and how to do that. But I really think because of the other issues about treatment issues and what can happen beyond that, I think 30 days is too long.
Director Landry, I wanted to come back to you. You had a comment.
The only comment I wanted to add was I wanted to make sure that Mr. Bicknell understood I made an analogy there. I'm not indicating that they are providing medical services in many cases. These consents that we're referring to here are non-medical services, or certainly not, we don't consider them the same. So again, I made an analogy, not a direct comparison. One thing I would just simply offer to Representative Perry's comments, if I may, is if the committee is going to indicate that they're interested in expanding or extending the amount of time for the consent, I would then suggest that we are provided the opportunity to include in any rulemaking the requirement of the notification, since currently those are considered to be one and the same. And again, that would be one way to be clear about the notification aspect in both chapters, with the consent potentially having a different period of time.
And thank you for that, for clarifying that. And how would the department feel about a 48 or 72 hour consent window?
We would prefer no more than 24 hours, which we think is reasonable and fair to parents and guardians to be able to consent to treatment for their children or as legal guardians.
Okay, thank you for that. Chris?
After talking to the other providers prior to this work session, we are completely open to, a reduction below 30 days. But I think 24 hours is still a very short amount of time to work with a family that is actively in crisis and maybe looking to, I feel it's a pretty short amount of time to move a family from being in a punitive place with their child to being in a supportive place with their child. And so a bit more time than 24 hours would be beneficial.
And as I read the language, the stipulation was that to begin obtaining consent, I didn't read it as saying it has to be done by a certain time. Okay. So any other thoughts about emergency shelters and time to initiate permission consent? Yes, Ms. Dooling.
I'm sorry, not to confuse the issue, but that's not how I see Chapter 9's rules. It's under emergency admission. It says within the first 12 hours, the facility shall obtain the consent of the guardian. That's not
Okay.
begin to.
So then my question to Dr. Landry is, what happens if the family doesn't consent at 12 hours? What happens then?
Well, perhaps Mr. Bignell can give a operational perspective on that, but from our perspective, that at that point they could involve the department with a potential concern regarding a report, if you will, and the department could get involved at that point. If there is no issue of abuse and neglect, then ultimately, similar to other ways that or other situations where consent is obtained, they would not be able to continue to provide services.
Okay.
That is correct. And what our concern is for those youth who maltreatment is not obvious and present, those young people came to us for a reason, and they are not returning home when services are denied as a result of failure to get consent from the parents. They are ending up in other unsafe situations in the community, as was clearly stated in my testimony.
Okay. Thank you. Thank you for that. Yes, Senator Baldacci.
I think we all agree that 30 days is too long. I agree with Representative Perry that 48 or 72 hours would be an appropriate standard. I would just ask Mr. Bignell if we made the standard 72 hours, would that's 3 full days. Would that be a sufficient time to, I understand there's a lot of work that has to be done with the family, but at least to get the process started. With 72 hours.
That would be a significant improvement. I would advocate for 5 business days.
Okay. Thank you, Mr. Chairman.
So I do feel like we need to point out that all of the times and dates and references we're bringing up at this point are based in concern about the kid and how best to meet the kid's need. I want to recognize that we're on common ground there. We've heard from the department that 24 might be manageable, acceptable. I think that's a better term. Any other thoughts about the time frame? So the range at this point is between 12 to 7 days, 12 hours to 7 days, down from 30, is what I've heard so in a recent conversation. Okay, so a specific recommendation from Senator Baldacci was, I think you said 72 hours, sir?
Yeah, I would modify that maybe to 3 business days because of the fact that there's, if the child comes in on a Friday, then you have short staffing probably on the weekend. So I would say 3 business days.
And
can I ask a question, Mr. Chairman?
Sure.
Okay, so I can understand why some people are confused because I think we had a discussion last couple of days and several of us were still confused, but let me all I want to know is if we extend the shelter to 90 days, when do the parents have to provide consent within those 90 days?
So right now you're talking about 2 different shelters. That confuses things. So
yeah, I guess
let's stick with the consent process for right now and how long we want to give that to happen.
You mean the notification?
No,
Oh,
we're talking about the consent process. The notification happens within 3 hours. Either it's going to the department if the kid's at risk, or it's going to the guardian. Do I have that correct, gentlemen? Dr. Landry and Mr. Bignell? Yes.
Not under current statute, but as I understand what you're proposing, yes.
So I do think, and I didn't answer your question, Dr. Landry, but yes, I think it would be reasonable to include notification language in 8 and 9 that were consistent, and also consent language in 8 or 9, at least the framework of which was consistent. So Representative Perry.
Yes, I'll see if I can remember what I was thinking, but now the difficulty is I don't want to see 3 business days. If this is an emergency shelter, it doesn't make any difference what day of the week it is. That child is there. Notification has to happen, whether it's on the weekend or not. That's when you start the work. So I would not say 3 business days for that work to begin. First of all, if you don't begin that work at the time of notification, you've already created a rift between the provider, the treatment provider, and the family. And that communication has to begin immediately and be worked on as time goes on. So I would not say business days. 72 hours is somewhat long for me. I would rather see 48, but I will go with any of the shortened that comes up, but don't do it by business days.
I would just say from a provider perspective, business days are every day of the week for us. Weekends don't matter. We are staffed based on client to staff ratios that are regulated by licensing. So we would be okay with that.
Thank you, Mr. McNally. Yes, Senator Baldacci.
Well, I would make a motion to amend that provision to 72 hours, not 3 business days, 72 hours.
Okay. Is there a second for 72 hours as we work through this legislation? So,
I'll
okay.
second it for discussion's sake only.
Well, we've had a pretty good discussion so far. Yes, this dueling.
Right, so that's one of all the pieces we've been discussing this morning.
I understand that. I understand.
Okay, so the motion is only including this one piece,
That's right.
and it's only about chapter 9.
That's right.
Okay.
Yeah, we've dissected this frog and we're trying to put it back together. Yes, Representative Perry.
You don't need to make this a formal vote. This is just consensus.
Mhm.
Of what we're trying to figure is where the committee stands on this part. And I just want to see the consensus of what the committee members think.
Are people comfortable going around the horn and offering hours for notification proposal? Representative Lemlin?
Yeah. Thank you, Senator. I'm at 24 hours. I can't go any longer than that. I'm sorry.
Thank you. Representative Stover?
I would stay with the 72.
And Representative Meyer?
I would remain at the 72.
And Representative Griffin?
I wouldn't go longer than 48 hours.
And Representative Perry?
I would rather see 24 to 48 hours.
And Representative Madigan?
I would like to stay with the 72.
And Senator Moore?
I am all over the place. 24 or 48. I'm just so confused with everything. Either one of those would work for me.
Okay. Representative Craven?
I would stay with the 72.
And Senator Baldacci, you've already offered 72, am I correct?
You are correct, sir.
Okay. So a quick poll means we haven't decided. Representative Senator Libby.
Thank you, Mr. Chair. I just want to make sure I understand which part of the bill we're talking about. We're talking about 24 or 48 or 72 hours for the emergency shelter to obtain parental consent for services. Is that correct?
Yes.
We're not talking about notification. I've heard committee members say
No.
notification is part of this discussion, but we're talking about giving the shelters some additional period of time to work with the family and do the back and forth to obtain consent.
Yes.
Okay.
This is a consent permission discussion. Has nothing to do with the notification discussion.
Okay. So what I've heard from Mr. Bicknell is that the process to go back and forth with the family to obtain consent can be time consuming depending on the circumstances. We asked for 30 originally. The department has this position that I'm really struggling to understand. If 24 is all they're saying they're willing to do, what they're doing is constricting the amount of time to work with the family to get the consent. And if the shelter fails to get consent, the only other option is for the child to leave and go stay at some less desirable place. So I just, okay. So I'm sorry. I'm
for
clear now on
clarification,
where
go
the
ahead.
discussion is.
Yeah, for clarification, I heard that differently. What I heard was that if the consent isn't obtained by whatever time, then the next step is one of the potential next steps is to get the department involved to check on the safety of the kid.
If it meets the department's standard for a life safety threat to the child.
Yes.
In that circumstance, there could be other circumstances where the department does not intervene.
Right.
Okay.
Did I understand that correctly, Director Landry?
Yeah, that is correct. I do want to just indicate that our statutory definition of abuse and neglect does include deprivation of essential needs. And so we do believe that the 24 hours, if it needs to then have the involvement of the department, would be the appropriate course to take versus waiting any longer to obtain parental or legal guardian consent.
Okay. So I had a couple folks interested in 24, some who were interested in 24 or 48, some who were interested in 48, and a larger number who were interested in 72. I'm open to suggestions. There was a motion made for 72 hours or I think it was 3 business days that was not seconded, because we ended up with an informal conversation. So, yes, Representative Perry.
All right, but let's go through and see how many would be willing to accept 48, feeling that 72 will not make it.
How many people could live with 48 hours on the committee, I'm asking? How many people could live with 48 hours? And Representative Craven, it's the question to be asked. Representative Craven.
Thank you, Mr. Chair. I guess that I don't understand the theory behind getting consent in such a short time, if you can. I mean, if a family is struggling with sexual identity or something like that, it's going to take a while for them to get used to and to accept the child's identification, and for them to be able to work it isn't that they don't know where the child is. It isn't that the department isn't notified. And so I guess I would like to hear from people who, I mean, I could go for the 5 days. I think that when somebody's working on the ground, doing the actual work, that we should hear what they have to say, because for us to imagine what might be going on is a hard thing to do, whereas they're involved in it every day of the week. And so I just would like to hear, I guess, from people who want to hurry it up to that degree, even though the child is safe and everybody is notified. Thank you.
Before we do that, can we get some clarification of what the permission is for, what the consent is for? Is the consent to work with the child blanket? Or does it include specific agendas or specific steps or tasks? When a parent is contacted, are they being asked, we know where your child is if they're at high risk, and we need your permission to continue to work with the child to try and get the family back together? Is it a global permission, or are there specifics involved in the process? So I'd like Mr. Bicknell, can you weigh in on that at an operational level?
The initial ask for consent to stay is global, and then if consent is given, we immediately begin talking about the specifics of what that means. And so, first of all,
go ahead.
So
okay,
first of all, it's really, is it okay for your young person to stay here? And if the answer is yes, we're talking about family mediation. We're talking about connecting with education, connecting with mental health supports if they need it, whatever it is that that young person needs in order to return home. And not just the young person, but the family, because the young person and the family are not separate entities. They're one and the same. And so that is our goal and intent.
So that's a much less specific ask initially than was implied in Dr. Representative Craven's question.
When a young person does arrive, we are by contract required to provide a certain set of services because we are operating 24 hours. It's food, it's education, it's if they need employment support. There's lots of things within that contract that we're required to do, and the details of that get worked out after the initial consent to stay is received.
Representative Lemelin, you've had your hand up. Thanks for being patient.
No, thank you, Senator. A quick question to you, Senator. Are we still talking about both bills at the same time, 81 and 1076?
Yes, and the thought was that maybe we could pull the language out of both bills and put it in one and leave the appropriation in the other. Since we're talking about language, mightn't those all go together? As I'm listening to the conversation, I'm increasingly concerned that some of the language that people really care about might get lost in some of the language that isn't quite as important. Does that answer that question?
Yes, it does. Thank you, Senator.
And the other argument was that the other reason for doing it that way is that they're certainly similarly related, in the topic area. Representative Perry.
Yeah, the question I have in the consent, because I get the sense that the consent is also the consent to have those services provided, as well as can those services like counseling and that kind of stuff be provided without consent? And my question is, does the consent then allow the services to go on? And if that's the case, the sooner it's done, the sooner you get started with what has to happen. So when I look at consent, that's what it means. And that means then if you wait 30 days to get consent, this child is not getting the services that they need to have consent to get. And that's the question that I have when we're talking about consent. That's what I look at.
It's the observation of the chair that this would be a whole lot easier if we were sitting around a horseshoe and we could do a thumbs up or thumbs down on which we can probably do shortly here, which I'm gonna revert. Yes, Ms. Dooling.
I just wanted to Mr. Bicknell said correctly that the consent is about admission to the facility that's licensed under Chapter 9. And so if there's no admission, I think there's no services.
And the consent is not specific to the services that are then subsequently offered. So it's a very narrow definition. Okay. All right. Who can live with, not be enthusiastic about necessarily, thumbs up, who can live with 48 hours? Okay. Who can live with 72 hours? I'll go out further. Who thinks it ought to be at 24 hours? I see one thumb, hands up. And so I haven't heard from Senator Moore because she voted for all three. How do you feel, Senator?
I had my thumbs up for 48.
Okay. And how about you, Representative Griffin?
Sorry. I had mine up for 48 also.
Okay,
And can I just make a comment real fast?
please.
Okay, I agree with Representative Perry that just from my experience as a teacher, the quicker you have intervention, the better. So the quicker you can get somebody's services, the better off that youth is going to be. And that, getting back with the family and working with the family, I think is important.
Yes, Representative Meyer.
Thank you, Mr. Chair. Just circling back to Representative Perry's question. I see Mr. Bicknell has his hand up. Hopefully you can answer.
Okay,
We're
Mr.
talking
Bicknell.
about consent is
Okay.
tied to admission. It's not the initiation of services. Is
Right.
that correct?
Mr. Bicknell. Did you want to answer that? You're still muted, sir.
Sorry, that is correct. I will say that as soon as a young person walks through our door, they have access to services. One of the services we offer is shelter. One of the services we offer is safety. We offer counseling and guidance and crisis support, and that is all available immediately, even before the 3-hour notification is required to happen, because we are a licensed facility. We can't have someone in our building that is not receiving services. That is an impossibility.
Okay. Senator Baldacci?
In the interest of consensus and resolving this issue, I could live with 2 business days. That's the ultimate compromise on this, okay? Because if they can live with 2 business days, I will come over from 72 to 48.
That's your version of the ultimate compromise.
Yeah,
That
that's
may
my
be the
version,
ultimate
exactly.
compromise. Just for clarity. All right. Yes, Representative Perry.
I'm sorry, but that leaves a very uneven access to getting admission for depending upon what day you go in. And I think that leaves equity out of it. So I would recommend staying with the 48 hours.
Okay. Senator Moore.
Well, I'm just going to make the comment that Chris Bicknell actually said their business days are 7 days a week. Right. So there really isn't a necessity of classifying as a business day or a non-business day.
Right. Oh, Mr. Chairman, may I just say something?
Please.
I understand. I agree with Senator Moore. That's what he said. But the purpose of the proposal was to provide some flexibility in the time frame. That's all. But Mr. Chairman, how are we going to resolve this?
I'm going to put together a list of what I've heard step by step of these things and see if there's anybody willing to make that motion. The other alternative is to split out the language which is the most contentious and deal with just the language of 30, 60, 90 days and get that done. So that's the content in LD 81, is to just deal with the number of days that somebody can stay and not further complicate the bill by working on the language of these other issues. So those are those, and then we could leave those issues if you wanted to in 1076 along with the appropriation. That makes them vulnerable to the AFA table, and it makes some of the other language changes vulnerable to the AFA table, and I'm not sure that's where they should land. So that's the concern, part of the concern. So Senator Moore, I saw a head nod. Was that?
I like the idea of taking the LD 81 and using that for the language and then leaving the extra funding on 1076. separating
So-
them up. I think that would be the way to go.
So are you then thinking that we should stick with putting the notification discussion and this permission discussion into 81?
Correct.
Okay. Anybody,
fine.
any thoughts about that? Senator Libby?
Mr. Chair, this is obviously the committee's decision because the bills are now in your possession. I'm more interested in getting this issue solved than who gets the credit for it. I'd be very happy for the language to go into Representative Meyer's bill. And in the interest of finding consensus, I think we would take 48 hours over what we have now if we can get agreement on 90 days and if it looks like we're headed to a unanimous report on this bill.
And that's the goal with our work towards consensus. Senator Baldacci?
Based on Senator Libby's comments, then I will support the 48 hours in the interest of getting the 90 days passed. Because I think ultimately that's the most important thing, as well as the funding. So I will accede to that indication, and I will agree to 48 hours if that's helpful.
Okay. Then one other question. Yes, Representative Craven.
Sorry, that was an accident.
Okay. Representative, sorry, I'm tired. Director Landry, can you help us understand what happens as a youth approaches the end of their time in a facility generically, not picking one or the other, and they're still considered at risk for going back home? What happens to make sure that those kids are protected?
There are multiple avenues, Senator, to answer your question. One of the things that I would say is if there's an issue of a potential concern of safety within the statutory definitions, then there should certainly be, by then, I certainly would have expected, whether 30, 60 or more days, that the provider will have made a report into the department for potential investigation. Absent that, let's just say that there may still be issues that do not rise to the issue of abuse or neglect, then our expectation is that the providers are working with the youth and whenever possible, their family to help identify a safe alternative placement outside of a temporary shelter. If they are reaching the end of their time period previous to the executive order, 30 days, then at some point in advance of the end of those 30 days, they could easily request the department to extend the authorization for an additional amount of time in order to work out those issues and hopefully have the child return to a safe placement, preferably with their families, but if not, perhaps an alternative location such as a relative.
So I'll ask specifically of Senator Baldacci, does that address your concern enough, sir, about adequate protection for kids at risk as they approach the end of their initially designated stay?
Yes, that does. Thank you, Mr. Chairman. I think that resolves those issues we discussed previously. And
that was a concern that came up before, wanting to make sure these kids are protected beyond whatever date we land on.
Right. Thank you,
Okay.
Mr. Chairman. I appreciate that.
Okay. So what I've heard, and in the interest of clarifying things a bit for Ms. Dooling, is that there's some sentiment to extend the shelter duration, both for emergency and homeless shelters, to 90 days beyond the 90 days as opposed to the 60 days proposed by the department. There's also sentiment for including both notification language and consent permission language in both chapters 8 and 9. And there's some commonalities for a number of people around the 48 hours for the permission consent portion. have I summarized where we've begun to land? I see one thumb, two, three, and a smile. Okay. Are there additional points to be made for those issues that we've been discussing? And respecting that there's differences of opinion on some portions of this. So Ms. Dooling, if that was the direction of the committee, would you have the information that you needed to recraft the bill? The answer is no.
No,
would you need?
I don't understand what you're proposing around notification. And then you're adding a consent piece to chapter 8.
So the notification language, as I understand that exists in section 3 of the chapter 8 should be the same as notification, which doesn't yet exist in chapter 9, is what I'm thinking.
Oh, okay. So the existing notification language relating to chapter 8, not the section 3 proposed changes in the bill, but the existing notification in chapter 8 would be directed to be included in chapter 9.
Yes. And that's because we understand now that within hours of a youth arriving at a shelter, either DHHS or the guardian is being notified, or people are trying to reach one or the other, depending on the child's circumstances. Does that clarify that piece?
Okay. And then you're adding a consent provision, 48 hours that you want in chapter 9, and adding that to chapter 8.
So before we do that, I'd want to make sure with the department and Mr. Bicknell, and as I understand it, the different licensing structures, there really are no services that are going to be provided beyond food, shelter, safety, and some support for the homeless shelter, that being very different than what would be for an emergency shelter. Do you need this provision for consent to stay in chapter 8? Homeless shelters. Yes.
This is where it
Mr.
starts to
Bicknell.
get really complicated. The department is currently considering combining the 2 licenses into 1 license. It would be helpful if rules were consistent across both, except for the 24-hour and 12-hour component.
Mm-hmm.
I believe, I don't want to speak for Preble Street or Shaw House, that they consider the services they offer in their day programs as part of a continuum of care that includes day programming and overnight shelter. At Shaw House, they are in one and the same building, and youth just go up and down stairs. At Preble Street, it's literally across the street. They just walk from one building to the next. They view it as a campus model.
Okay. So I'll go to Director Landry then. With the department, what's the department's response to the idea of putting notification language and consent language that matches in both chapters 8 and 9?
We have been considering changes to these licensing rules, as Mr. Bicknell knows, because we've reached out to providers for their input and information. We would certainly take that under consideration, but I'm not in a position right now to be able to give you a definitive answer, since this has not been posed quite in that way at this point.
Okay. Okay. And we're in rules at this point, right? Yeah.
Most certainly.
Yeah. And that makes me somewhat uncomfortable. That's Representative Perry.
Well, I'm thinking that we shouldn't go into the other chapter if they don't have permission already. If they're going to be changing licensing in general, that's when all of that stuff will come together and be the same. But right now, the way these two are viewed, consent in a homeless center is only not about services.
Mhm.
And I don't think there's going to be a need for consent in that. However, if the department then changes the licensing, all of the rules will then become the same. So I think that's something we should leave up to the department and not confound it by adding more.
Okay. So to the sponsor, would you be okay with the 90-day provision standing alone in LD 81? That we drop the conversation for the time being about permission timing and consent timing from 1076, and that we just leave it as a appropriation bill. That's what I heard Representative Perry offering. Senator Libby?
Is it a question to me, Senator?
It is, as the bill sponsor, out of respect for the work that went into getting us this far.
I would be fine with my bill being the vehicle for the appropriation. My goal is to get consensus on the language changes with this committee that address the needs that were brought to me by the providers.
Yep. Yep. Representative Perry.
I hate to keep coming back, but I think when we talked about language, I was recommending we keep what we had said about getting consent in the emergency shelters.
Okay.
But not put it in the homeless shelter as it's not there already.
I'm fine with that.
Department
Okay.
does.
Okay, thank you for clarifying that. So, Mr. Bicknell, just briefly, and since you've been here so much this morning, would those provisions help New Beginnings? We'll make it real
Yes.
specific.
Yes.
That's a step, and that moves the needle. Okay, so I would entertain a motion then, I'll restate it, to extend the stay in shelters to 90 days, which is what I've heard, that we remove the language in Section 3, Chapter 8, as it is written in the bill, that talks about permission, because that doesn't belong there. And that in Section 4 of the Chapter 9 of the emergency shelters, that we go with 48 hours for permission. Representative Griffin.
When it's the right time, we'd like to corner caucus if it's possible.
So that I think any time that you'd like to corner caucus is a good time for one of those. So we'll take a break at this point. We'll go to
Mr.
court.
Chairman, can we corner caucus as well, or
Yes, we
with
can.
Senator Libby?
Senator Moore.
I just want to make sure that we're understanding before we go into caucus. So the language that you were proposing about changing it to 90 days and then changing the consent to 48 hours in Section 9, that's going to go on LD 81, correct?
Yes.
Okay.
That's
And then
that's one of the proposals.
Okay, and then
Yes.
1076 will just be the mechanism for the additional funding. And all the other
Yes.
sections will be removed from 1076 that we've been talking about, correct?
Are you okay with that description, Ms. Dooling?
I'm sorry, I'm a little confused. Can I just repeat what my understanding back to you? So I see that Section 1 and Section 2 of both bills would be changed to 90 days, or either bill. Either the Section 1 or 2 are the same. It's the same section. Sorry, that was more confusing. That direct the department to amend its rules in Chapter 9, that the period of obtaining consent from the guardian would be extended to 48 hours.
Yes.
And what about the provision about directing that the existing notification provisions in Chapter 8 be included in Chapter 9? Have you walked away from that?
Yes. I ran away from it.
Okay.
Is that clear enough, Senator Moore?
I believe so. Thank you.
Okay. Okay. Mr. Bicknell.
Yeah, just before you go into caucus, I'd like to just make a couple of brief statements. One, that I want to thank everyone on the committee for taking the time to dive deep into this subject matter because it is pretty arcane and complicated. But also, I think it's important for every member of this committee to know that under Dr. Landry's leadership, the department, OCFS, has engaged partners and providers with a level that has not been seen in my career here in Maine, and also the level of transparency, and that's actually extremely hopeful, and feeling very strongly that this level of cooperation is moving services forward for youth in the state. So I just want to thank Dr. Landry for that in front of this committee.
Thank you for that comment. Dr. Landry? You're still muted, sir.
My apologies. I do want to point out, based on what I understood your answers to Ms. Dooling were, that under what you're currently considering in Section 9 for emergency shelters, there would be no notification period required. And with the change, that there could be, in theory, a situation where a youth or child could be in the emergency shelter for 48 hours before the parent was even notified.
And that was not the intent of my summary, but thank you for being clear about that. That's why we do these things.
If I may ask Ms. Dooling if I misunderstood that.
My understanding, Dr. Landry, was the same as yours, so perhaps we need
Okay.
more clarification.
Thank you. I think what I heard has consistently in the committee is that notification should be happening within hours in both sections 3 and 4, chapters 8 and 9, that the notification should be happening within hours. And as I understand it, that's in place in the emergency. It is not in place, that language is not in place in chapter 9, but should be, because that's the intent of the committee, is to get to immediate notification of the guardian or the department.
So right now, my understanding from our discussion has been that because the current consent requirement under Chapter 9 is 12 hours, that the department sees obtaining consent and notification as a simultaneous process.
Right.
But by the committee's proposed amendment to extend the period of time to obtain consent to 48 hours, that you would be looking to separate those ideas out. And so you would keep the 12 hours that's currently consent and notification wrapped up together, but now it would be 48 hours for consent and 12 hours for notification under Chapter 9.
Representative Perry, are you nodding your head? You're on mute. You're still muted.
Sorry.
Yeah.
I don't want the notification to change. The notification is very important, and notification should certainly happen well before consent. And I was of the understanding, and maybe that's in the HOMA shelf, that the notification occur within 3 hours or something like that of admission.
Right,
So
that's in Chapter 8.
that's in Chapter 8. Let's put that in Chapter 9. Can we do that? Because if you have 48 hours, you want to start working with them as soon as possible. And I would think that notification should be early.
That's what, yes, thank you, Representative Perry. And with that understanding, does that address the concerns you had, Dr. Landry, about 48 hours? That's certainly not the intent of what the committee is. We need to be clear on the language that that's not the intent. These are kids who need to be protected, and they need therapy, and the guardians need to know where they are. So I don't hear any different amongst the committee members on that. So.
Thank you, Senator Claxton. I was just simply pointing out what I heard in your answers to Ms. Dooling, and I wanted to be clear about it.
And I appreciate that. This is a We're making sausage here, people. So let me just look at the language of 81 again. I'm sorry, I'm going back and forth between these two bills so many times, you'd think I'd have them down.
Can I clarify before we talk about that? So,
Yes.
so currently, under Chapter 9, notification effectively, even though it's called consent, also is
Mhm.
12 hours. You're proposing to reduce the notification under Chapter 9 to 3 hours and extend consent to 48 hours. Is that correct?
If you're asking me personally, I'm inclined to not change anything that we don't have to change. So I'd leave the 12 hours for notification. That's already exists. And we'd make it clear that that applies to notification and not to consent. We'd split the two, but leave the 12 hours.
Okay, I'm hearing different things, I guess. I heard something different from Representative Perry.
Well, Representative Perry, what had you intended?
I intended to make it equal on both sides. In other words, Chapter 8 and Chapter 9 both have the 3-hour limit.
For notification. And how about, would you settle for immediate instead of 3 hours, or?
Immediate might actually make it shorter.
And I know, okay.
Mr. Chairman, can we go into a corner caucus?
I want to hear from Representative Griffin first. And we got to be clear about what we're talking about before we go into corner caucus. There's no point in resolving issues if we're talking about different issues. So Representative Griffin?
Well, I just wanted to clarify my own brain. It does say within the first 12 hours. So I'm just assuming, that is something you're supposed to be working on, a consent within those first 12 hours. So does it need to be 3, or should it just be through the first, through those first 12 hours? Then you wouldn't have to change anything because the 3 hours would be within the 12
Sure.
hours.
As long as it's clear that we're splitting off for emergency shelters, the issue of notification is different than consent if this language gets adopted. So the notification would be within 12 hours and the consent would be within 48. Yes, Senator Moore.
So if we're looking at section 9 right now, as we were saying, there's no section that talks about notification.
Yeah, that's because we've waded into the weeds and
I
we're
know.
dealing with rules. What
Well,
we've
but
been
then now we're
told-
talking about changing the consent to 48 hours, but we want to leave the notification at 12,
Yes,
is what I'm hearing. So we're going to have to add the word notification in there.
right. Yes, we're going to have to add the provision, and Erin's going to help us figure out how to do that. But that's what's happened. We've gotten into the weeds far enough that we're dealing with rules. Representative Lemlin.
Thank you, Senator. I think I'm as confused as Dr. Landry because he's shaking his head the same way I am. I'm not understanding this fully because where was the 3 hours in all of this in the beginning?
That was an operational phrase that came from the people on the ground and describing in essence what happens. So that's nowhere in rules or statute.
No, it's in the rules in Chapter 8.
Oh, okay. That's not in any rules that we've looked at or in any statute that we've looked at.
Right, and that provision is on the bill analysis on page 3
Right. Does
for your
that
reference.
additional questions, Representative Lemlin?
Well, yeah, I mean, if it's already, so it is in there. 3 hours? Is that what you're saying, Aaron?
For facilities licensed under Chapter 8, yes.
Okay.
Notification would need to happen within 3 hours. That's
Correct. That is my understanding, and I'm hoping that stays.
That we're not talking about changing. Okay.
Thank you.
That's right.
Yes, Senator Libby.
Thank you, Mr. Chair. I wondered if I could have leave to ask a yes or no question of Mr. Bicknell and Dr. Landry.
you can ask me and I'd be glad to pass it along and they'll hear it.
Thank you. On the proposal to consider 3-hour notification, 48-hour consent for both licenses, Dr. Landry, do you see any issue with making that change from where you sit?
Yes, because the current Chapter 8 doesn't require consent.
Your question would add consent to Chapter 8.
I'm not going to ask my second question. Thank you.
The chair is grateful. Representative Lemelin.
Yeah, just one last question to Dr. Landry. Are you concerned about that change in Chapter 8?
So we're not, so just to be clear, we're not talking about a change in Chapter 8, right, Aaron?
That's my understanding, that you're not talking about directing any changes to Chapter 8. My understanding was about the discussion is whether you're mirroring any provisions in Chapter 9 based on what's existing in Chapter 8. And that's why we're talking about the 3 hours. It's whether you want to set that as the upper limit of notification in Chapter 9 to make it consistent with Chapter 8, or whether you're okay with having the upper limit be 12 hours as it currently exists if you split off the consent and notification requirements in Chapter 9.
Does that answer
that
your
make
question,
sense?
Representative Lemelin?
I think so.
Okay. Yes, Senator Moore.
Just one other clarification, that we are talking about changing the duration though in Section 8, the 90 days.
Yes.
Yes, yes.
Okay, I just want to mention that because it
Mr. Landry.
Yeah, if I may, I would like the opportunity to answer Representative Lemelin's question. I will say, as I understand it, there would be on the notification period in Chapter 8 for homeless shelters, there would be no change from the current 3 hours. I further understand from Ms. Dooling that the committee is considering modifying the Chapter 9 for emergency shelters to require a notification within 12 hours. It makes, from a subject matter perspective, I have no, I don't understand why there would be any basis why you would want parents notified within 3 hours if their child is going into a homeless shelter, but waiting 12 hours to get that same notification in an emergency shelter. That just doesn't make sense to me, and I thought I would provide that to Representative Lemelin's question.
Yes, Representative Lemelin.
Yes, thank you, Senator. Yeah, that was my concern. I agree with Dr. Landry 100%.
So,
Now I'm really confused, and I'm really sorry. Dr. Landry, you just confused the heck out of me. I thought that the 3 hour limit under Chapter 9 was existing rules, and that the 12 hour, I have it under Section 5. The facility shall make good faith efforts to notify a guardian by telephone within 3 hours of accepting the child for overnight admission.
That was Section 8.
Okay, I might have miscopied it, but I have it under 5A.
We can verify. I do not believe that that is the case for Chapter 9. I believe in Chapter 9, the previous rulemaking process ended up with this combined 12 hours for notification and consent. Mr. Bicknell may be able to offer some additional guidance.
I'm starting to get confused as well. I will say that from a provider's perspective, we have no problem with immediate notification. That is our intent always is to let the parent or legal guardian know where their child is and what conditions under which they are being served. And 3 hours has always been fine with, the shelters for homeless youth, and emergency shelters are slightly different, but I do not think that they would have a problem with notification or attempts to notify with good intent, however the language is, within 3 hours. That is perfectly acceptable and reasonable.
Ms. Dooling, do we have a vehicle to split out a third or create a third bill related to this? Do we have some bills that are currently on the table that could be used to create a third bill to address
Well,
chapters 8 and 9
if you
independent of
can,
the 90 days?
if you reconsider the department bills that you killed about child protective, which were currently unanimous, ought not to pass and haven't been reported out, you could reconsider those and use them as a vehicle. I don't know about other existing bills relating to this topic. You have two here.
Representative Perry?
Here we go again. But LD 81 would have the language extending to 90 days for both Chapter 8 and Chapter 9. And then in Chapter 9, you change notification to 3 hours and consent to 48 hours. And that's all that will be in 81. And then in 1170, I forgot the number,
1076.
Yeah, then that will be the appropriation. That's what I'm looking at. Does that make sense?
And yes, and I think that's a summary of where we are. The only other option it would be to split out the conversation about notification and permission, which we've been laboring on, into a separate bill to make sure that some of these changes will get through that are important. That's the only other consideration that I've heard.
I think it's going to be simpler to keep it all together.
Okay, Senator Moore?
That was what I was going to say. And I think that, Aaron, I may be taking this simple. I think you would have the words from Section 8 for the notification of the 3 hours. You could just use the same words for Section 9.
I'm not sure. I guess we're not looking at the same thing because I don't know what Section 8 and Section 9 are off the top of my head. Can you clarify for me what the policy points would be around the notification for Chapter 9?
That's the problem, Senator Moore. We've gotten into the rules, and there are rules in Section 8, which is the homeless shelters, that require the 3 hours. The question is, are we telling the department to lift that language and place it in the rules for the emergency shelters, Chapter 9? And Dr. Landry's argument is, if we don't, then we're notifying the folks going to homeless shelters in 3 hours and the folks going to emergency shelters in 12. And
that's why, yeah, and I'm in agreement of using the same words for Section 8 and Section 9 for the notification.
Okay. So, Dr. Landry, your response to that clarification?
Yeah, I would simply say what I heard Representative Perry say in summary of what I understand the committee is attempting to do is exactly accurate.
Okay.
And so I think what she has summarized on what would be an 81 versus 1076, from my view, accurately sums up where I believe the committee is considering right now.
Okay. So, Representative Perry, you want to keep 80, you want to keep 81 and change it to 90 days.
81, change it to 90 days. And then under Section 9.
Also in 81.
Notification to 3 hours. In 81, change notification to 3 hours and consent to 48. And then in 1176 is the appropriation.
Okay. That's the understanding we'll take to our corner caucuses. And it's now, oh, amazing, 11:10. How long do you think you might want to take, Representative Griffin and Senator Moore?
What's you saying? 5 to 10 minutes?
Let's go with 10, and we'll
Okay.
get back here hopefully by 11:20. Thank you all.
Do the committee Democrats all have your link? It's the recurring link from Senator Claxton.
Okay, it'll take me a minute to get there. Don't panic.
Chris, I'm going to see if I can join the Democrats caucus. This
Okay.
video
Should I
stream is
just
still
wait for
live.
them to return and hear what
Yeah.
comes out of it? Okay,
Yep,
thanks.
this video stream is still live, just FYI.
All right, thanks.
So that's pretty close, 24. And I was last one in because I had to log out and log back in again. All right. So, have you all concluded the work in your caucus? Great. So I understand that Representative Perry is going to be offering a motion.
Yes, I would move LD 81 as amended, the amendment being to move days up to 90, and under section 9 to require notification within 3 hours and consent within 48.
I'll second that motion.
So the motion has been moved and seconded. Is there additional committee discussion about that motion? There being none, then we will move to Ms. Withy. And you can run the roll of the votes.
Representative Zager. Representative Zager is absent. Representative Lumlin.
Yes.
Representative Lumlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Connor. Representative Connor is absent. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Javner. Representative Javner is absent. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 10 yes, 3 absent.
Okay. And yes, Representative Perry.
Yes, I would like to move LD 1176 as amended. Remove language.
1076.
1076. I can't read behind Carrie. 1076 with the language being removed and the appropriation being the bill.
Okay, and I'll second that.
Motion's been made and seconded. Is there any discussion amongst the committee? There being none, we can go back to Ms. Withy for a vote on LD 1076.
Representative Zager. Representative Zager is absent. Representative Lumlin.
Yes.
Representative Lumlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Connor. Representative Connor is absent. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Javner. Representative Javner is absent. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 10 yes, 3 absent.
Ms. Dooling.
Can I have permission to add in the clarification on the funding piece that it's applying to both facilities licensed under both chapters, and direct the department to amend the rules to make the 90 days consistent that you're changing in the statute, just make that consistent in the rules?
Yes. So before we move on to the next bill, I have a couple observations. One, I want to thank Mr. Bicknell for your track record, your ongoing contributions, and your help with helping us sort our way through what became a complicated process.
You're
Thank
very
you for
welcome.
that. Senator Libby, thank you for bringing this forward. I've learned more than I wanted to, but I think we've ended up in an acceptable place. And I want to thank.
Thank you for your time and effort today.
I want to thank Dr. Landry for his, probably forbearance is the best word I can think of, but your clarity of thought and your helping us sort our way through some of these things. We really appreciate that, Dr. Landry. And then underlying all of it is the commitment for all the people in the room to do what we think is best for the kids and the children. And that's why we've just spent several hours trying to get this right after several hours of testimony. And it's a reflection of the commitment of the people in the room to do it right. And I'm privileged to be part of that process. So thank you all for your time, your energy, and your commitment. All right, big breath. And we'll go to the next bill, which is LD 972, an act to establish the Rare Disease Advisory Council.
Okay, LD 972 proposes to create the Rare Disease Advisory Council to advise the department and the public on issues regarding rare diseases. The bill defines a rare disease as one that affects fewer than 200,000 persons in the United States. The bill as drafted provides that the council is made up of 14 members who are healthcare professionals and others involved with or affected by rare diseases, including physicians, registered nurses, hospital administrators, a person from the department who provides education, sorry for the typo, around rare diseases, and a person who is responsible for epidemiology services, in addition to persons who have rare diseases or their parents. Additional temporary members may be appointed by a majority of the council's members, and the department is directed to staff the council. The duties of the council, as directed by the bill, is to study a variety of issues regarding rare diseases and their treatment within Maine, increase awareness of the diseases, establish a comprehensive plan to manage rare diseases, and develop a registry of rare diseases in Maine. The council must submit an annual report to the governor, the commissioner of DHHS, and the legislature, and must post that report on a publicly accessible website. You asked at the public hearing whether a similar bill had been proposed in Maine before. We had our researcher and OPLA did a lot of work and coordinated with the library, and they were unable to find a similar bill that had been introduced in the past. Fiscal impact on the bill, the preliminary report indicates approximately $185,000 in general fund in fiscal year 2021 and approximately $103,000 in the next fiscal year. In terms of drafting notes, typically with the creation of new councils like this that would exist in statute, we include an unallocated section at the end, which would establish staggered terms for member appointments. That way, you don't have all 14 or however number of members having their terms expire at the same time. There's some boilerplate language we could add for that if you'd like to go in that direction, but that's typically what we would do to make that work. At the public hearing, you also received a few suggested amendments. There's various amendments about which members might be added to the council, and then also about changing some of the duties of the council that I've outlined here for you, and I'm happy to go through them in more detail. I just want to note that for some of the duties, if they're being changed, it would be important to note precisely which paragraphs are being proposed to be removed, and would be looking for clarification on how some of the proposed suggestions interact with existing provisions, because it seems like some of those ideas were already covered, but we can drill down into that when you get there.
Thank you, Ms. Dooling. Are there any comments in response to the analysis? Comments, questions, concerns? I don't see any. Representative Craven, your thoughts?
Thank you, Mr. Chair. I think that we have some people in the waiting room that would talk about the proposed amendments, and if we could let them in.
Okay, so I'm not sure who all those folks are. So if you'd like to join in this conversation about refining this bill and changing the, at least to start, the change to adding to the members of the council, could you please put your hand up on your Zoom link? So do you know who should be included, Representative Craven? Because I don't see any hands going up. Nobody wants to play with us. There's
Anissa Reed
one.
raised her hand.
There we go. I didn't see the hand go up because I had my screen hiding it. Welcome, Ms. Reed. Glad you could join us.
Thank you. Thank you for having
So
me.
the question's been raised about the membership of the council. Have you any thoughts about that? After you introduce yourself.
I'm Anissa Reed, and I'm the state policy manager for the Eastern region with the National Organization for Rare Disorders. So I'm happy to answer any questions about our suggested amendment. The folks who we suggested be added to the council, we've seen be really successful in other states. It's really important to have a variety of perspectives. So we suggested that modification because we feel like it would add additional insight in this council that would add great value.
So I don't remember what was the total number of people in that list that you've put up?
We have, so it would be 1, 2, 3, 4, 5. So 6 additional folks.
6 additional. So that would get the council close to 20. Is that a number that has historically been workable in other circumstances?
Yeah, it's varied on the state. I believe the first one that was established in 2015, which is still going strong, there's about 25 members and they're very high functioning. But again, depends on the state, but it can definitely be a high functioning council with that number.
You were referring the high functioning to the council, not the members of the council. Okay. So any comments about the addition of another 6 members to the membership as proposed as an amendment? Is that an amendment that you would like to include, not necessarily make at this time, Representative Craven?
Yes, I think so. Thanks.
Okay. Okay. And then there was the conversation about duties. You want to walk us through that, Ms. Reed?
Yeah, absolutely. So what we recommend is instead of emphasizing research from the outset, which some councils have struggled to get comprehensive data on, and it can also be found through other rare disease websites and the NIH. So we've really found more success instead of trying to jump into data analysis that often already exists with rare diseases, is to have more of an open forum, solicit comments from the rare disease community, and as well as having them participate in public hearings and opening it up to the general public, also serving members within the rare disease community to find out what issues are important and impactful to them has been really beneficial. So that's our suggestion.
So that would require specific changes to specific elements of the duties that are already drafted in the bill.
Correct, yes.
Representative Craven, are you good with Ms. Dooling working with Ms. Reed to change some of the duties of the bill that you've drafted?
Yes, definitely.
Okay. And you should be part of that conversation so that none of the duties that you propose get left out that you feel are important. So if the three of you could work together and clean that up, and that would be great. Okay. Representative Craven, what about, well, certainly opening up the public, and I saw that there was a report needed. Is that an annual report or a one-time report? I'd like to clarify that.
Yes.
An annual report is needed, actually, because they're going to have changes ongoingly as they do their research.
Okay. And with the proviso, with the Perry proviso, that we can also write legislation based on that if it's appropriate for the committee. Okay. Anybody else have any questions or comments about this bill? Any concerns? Okay. Senator Moore.
I think at this point, I would make a motion that we do an ought to pass as amended on LD 972.
I would second that.
And we can revisit the language when it comes back for language review. Is there any discussion beyond that? There being none, Ms. Withy, it looks like it's your turn again.
Representative Zager. Representative Zager is absent. Representative Lemlin.
Yes.
Representative Lemlin, yes. Representative Stover. Representative Stover is absent. Senator Baldacci. Senator Baldacci is absent. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Connor. Representative Connor is absent. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan. Representative Madigan, yes. Representative Javner. Representative Javner is absent. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 8 yes, 5 absent.
Thank you.
Thank you for being here, Ms. Reed.
Thank you so much.
Look forward to seeing what comes of this committee. And thank you, Representative Craven, for bringing a clean bill forward.
Thank you.
All right. For those of you who aren't near a window, it's snowing out in Auburn. All right. It is Maine. Next, we'll go to LD 1009 and the Healthcare Ombudsman proposal. And I understand that Representative Madigan would like to speak to this at some point. Do we want to do that first or after the analysis?
Aaron can go first.
Let's go to the analysis.
Can you see that as
Yes.
like a whole screen, or is it cut off for you?
No, it's good.
Okay.
It's a little big, unless we move it around. There, that's better.
better?
Harder to read, but better.
How's that?
That works. Thank
Okay.
you.
So LD 1009 is a resolve to create a healthcare ombudsman position to serve the Maine's county jails. As drafted, it directs the Department of Health and Human Services to designate an intensive case manager working in the county jails to serve as a healthcare ombudsman to oversee county jail inmates with medical and mental health care needs and connect them to the healthcare services for which they qualify, and to also assist persons incarcerated to receive medications they need in a timely fashion. There were a couple of amendments and issues raised, particularly around oversight and the scope and authority of the ombudsman, which are similar questions that I would have in drafting based on this bill as it currently is. The fiscal impact hasn't yet been determined. The sponsor, Representative Madigan, proposed an amendment to create a task force or a group that would convene and study a design to support all the county jails with the needed resources and services for persons who are incarcerated, and how to obtain funding to sustain those programs. Membership of the council is outlined here. It would include 2 senators, 2 representatives, the Consumer Counsel System of Maine, community health providers, member with expertise in researching and funding, members with experiences in the criminal justice system, legal services organizations, statewide social services, housing services, the Maine Sheriff's Association, New Mainers, substance use disorder treatment, an advocate to reduce recidivism, and a supporter of Maine's incarcerated population, and to invite participation of the executive branch or any other relevant organizations, with a report to the Criminal Justice Committee, who will be authorized to report out legislation. There were a couple of requests around membership in the task force and topics to include study. As currently proposed, the task force, because it proposes to use the legislative resources by having 2 senators and 2 representatives appointed. It means that unless it specifically provides that it's not in compliance with Joint Rule 353 on legislative studies, it needs to comply with that rule that I've provided in the next few pages. So clarity would be needed around who is appointing the members, who are the chairs, how many meetings are authorized, and who is staffing the study. And I also wanted to note that the legislators proposed to be appointed to the task force will exceed the terms of their offices by the time of the report back. The joint rule is provided for your reference here. Legislative resources is defined to include membership on the study committee of legislative members. Our staff, meaning like me and Anna, are able to staff studies that meet the requirements of the joint rule. There's also a limit on the number of members who may be on a task force under that joint rule. I'm trying to find it. Sorry for jumping back and forth. And whether the majority of members needs to be legislators. Oh, here it goes. No more than 13 members. And whether the majority of members need to be legislators or not. There's also requirements about the due date of reporting. So that opens up a bunch of questions that I am not sure where you would want to go with that, but we can talk about that more if you need to.
Any questions about the analyst report? Any comments? Representative Madigan, how about your thoughts?
Thank you, Mr. Chair. In talking with Aaron and talking with the folks I was working with, I think it's most important that in any work group, whatever, that the folks who are really involved on the ground are involved. So I'm fine with removing legislators from that list of folks in that work group. The other thing in talking with folks is this tries to get at the same problem that Representative Dodge's bill about ICM case managers in counties without county jails addressed. And I think that has a lot of buy-in from the sheriffs because they're dealing with that. And I'm wondering kind of how we can combine those. I realize we voted that out, but I think I'm fine with trying to combine the ideas on this because they're really trying to address the same problem. My thought in doing this was we have 2 ombudsmen now in the states. We have the Maine Long-Term Care Ombudsman, which of course deals with folks who are aging or have disabilities. We also have the Child Welfare Ombudsman. And so I was trying to model it after that, just as someone who can look at the problems associated with the system and report back. And lots of times, I think, particularly in the case of the child welfare system, I think our current child welfare ombudsman has been so critical to the government oversight committee in trying to fix the problems within that system, because she really is someone who is separate from that system, but has the authority to look at where the problems are. So those are my thoughts on that.
Did you happen to speak with Representative Dodge about that idea?
No, I haven't.
Okay.
But I mean, not about this specific idea, because we just talked about it last night.
Yeah.
In general, I've talked with her about the bill and about the problem. We're both aware that these bills are trying to address the same thing. They're really addressing the same problem. I think the suggestions as far as folks on a work group that really specialize, that we add folks that have to do with reentry are really important. And folks involved in that, like ICMs or other people in the communities, would be great additions to this, because we don't want people to fall through the cracks. We want people to be able to access the services, the medical services they need. I mean, one of the things we really talked about was we often think of this in terms of mental health and substance use disorder treatment, but it is also medical treatment. You know, if you have someone who comes in to one of the county jails who has diabetes and that's unstable, that can really affect behavior, and it can be a really difficult problem for jail staff who aren't necessarily trained in medical emergencies. It can be difficult for them to manage behavior that may be due to medical issues.
Okay. So there's an idea about appending it to a prior bill that we voted on that would require voting to reconsider that bill. What do folks think about that idea? Senator Moore?
I'm okay with that. I think it would be a good idea to check with Representative Dodge. I don't think she'd have a problem, but I just think
exactly
before we do anything, yeah. So
Would it be easier to handle this just as the bill is as a standalone and know that the two can support each other? Representative Griffin?
Yeah, well, I'd like to see the two bills standing alone and maybe just working the two bills together. I mean, not together, but have the, Representative Dodge's bill, they just complement each other, I guess is a better word.
Okay.
They really
Okay.
do.
And I think they can do both, complement and standalone, if that's where you wanted to go.
Thank you. Yes, that's where I wanted to go.
Okay. All right. Yes, Ms. Dooling.
From a drafting perspective, there are some difficulties with using Representative Madigan's bill in order to create an ombudsman program that would be probably should exist in statute in some way to specifically identify the ombudsman's duties in the way that the long-term care ombudsman and the child welfare ombudsman are. Resolves are intended to be one-time directives or of a short-term duration, and it sounds like the intent of the ombudsman would be an ongoing program, and so a resolve wouldn't be the appropriate vehicle to handle those policy ideas.
Representative Madigan?
I thought of that, Aaron, and I'm wondering, does it make sense then to add that part of it to Representative Dodge's bill?
I can't speak from a strategy or political perspective about that, but from a vehicle perspective, Representative Dodge's bill is an act and would be able to fit statutory language in it in a way that your resolve cannot.
And that's actually the answer. I'm glad you answered that, because I wasn't thinking about it from a political perspective so much as just the, like you said, an act versus a resolve.
Mechanics.
Exactly, the mechanics of it. Thank you.
So Representative Madigan, just to be clear, the amendment that you're proposing, that there be a work group, is not a substitute for the bill that you proposed first. There are two pieces or several large pieces now to your legislation. Is that accurate?
Yes, I mean, the work group, I guess, I mean, clarification from Aaron, but it certainly could be in a resolve. We'd have to,
Yeah.
would have to resolve the questions as far as membership. And I mean, if we take out the legislators, then we don't have to worry about someone being appointed when, after their term expires, kind of thing. But then the other piece of it, the ombudsman piece, I'm proposing that we add it into Representative Dodge's bill, and I can certainly follow up with her on that.
As long as you're not proposing that the working group or the task force it exists in the long term and it's kind of a one-time convening and report back, then it can fit in your resolve.
Yes.
And do we feel like we have enough definition of the workforce task force goals? Is this to inform the work of the ombudsman, support the work of the ombudsman? What's your understanding of that?
I think it certainly could inform the work of the ombudsman. In addition, reporting back to us, well, to criminal justice, public safety. I would hope that if there's any action that needs to be taken, they could, report out a bill based on that.
Okay. So it sounds like there's some pieces missing. First off, might be a conversation with Representative Dodge, and then some work from Ms. Dooling in terms of how to marry the ombudsman program to her program and make sure they're complementary and not confusing or contradictory. And then there's your piece.
Sorry.
Go ahead, Ms. Dooling.
I'm sorry to interrupt you.
Go right ahead.
That's some drafting work about the ombudsman, but I would need a lot more direction about what an ombudsman duties would be and how that program would be created. I can't come up with that for you.
And then there's the cleaning up the language so that your bill, Representative Madigan, could stand as the vehicle for the work group.
Yes, and as far as I can tell, that we get out of the problem with the joint rules by taking out the legislators.
But they need some cleanup. So Representative Meyer?
Thank you, Mr. Chair. I would move to table 1009 while we work to resolve some of these issues. Get in touch with Jan Dodge.
I heard a second to that.
Yeah.
Why don't we can do a show of hands and I'll report the result. Everybody who's comfortable with tabling things, put your hand up so that I can see it, please. The only hand I haven't seen is Representative Lemelin's, and I see it. So it's unanimous of those present to table this motion pending some additional work as we've described. Thank you for
Chairman,
that.
can I ask a question?
Please.
Thanks. Did you take any votes while I had to step away?
Yes, we voted on, I don't know when you left. We voted on 81 as it ought to pass as amended, unanimous.
Well, no, I voted for, didn't I vote on 81?
As I said, I don't know when you left. I wasn't.
Oh, I voted on 81 and 1076.
We also voted then on 972, which is ought to pass as amended. That was 8-0 with 5 absent.
Okay, if my vote could be recorded as yes.
Yes.
Thank you.
You're all
I have
set.
Senator Baldacci down as yes, and that was for 972.
Yes.
And we just finished tabling 1009. Okay. Ms. Withy.
Thank you, Senator Claxton. Senator Baldacci, you also missed 979.
And what was the vote on that?
The motion was ought to pass as amended.
Mhm.
And the current vote is 9 yes, 4 absent.
Okay, then I'll vote yes.
Senator Baldacci, yes.
Thank you.
Thank you. All right, so according to my calculations, that brings us to LD 559, an act to approve basic and rights protections of people with acquired brain injury. And I understand the sponsor might be with us. And I'm going to turn over the table to, do we want to take a 10-minute break before we go to the last bill? Yeah, let's take a 10-minute break. We'll reconvene at 12:10. Reconvene at 12:10. Sorry, Representative Hepler. We'll be back. So we can resume our work. Before we do so, I'd like to apologize on mic to Representative Hepler for inviting her into the room and then disappearing on her. Sorry about that. When the chairs and leads meet shortly, we'll be looking for volunteers to remind the chairs to suggest breaks, since that wasn't part of my agenda this morning and we were overdue after a 3-hour sit. So my apologies, Representative.
No worries. I got to watch. It's now snowing here where I live. So
it stopped snowing and well, no, it's still snowing here in Auburn. So we're ready to hear from Ms. Dooling related to LD 559.
Okay, LD 559 is an act to improve the rights and basic protections of persons with acquired brain injuries. This bill is emergency legislation, which would mean it would take effect as soon as it were enacted. There are two parts to the bill. I'm going to start with the second one. It directs the commissioner of the department to convene a task force staffed by the department to develop and recommend rules and procedures regarding the rights and basic protections of persons with acquired brain injuries. And it establishes the duties of the task force, which include recommending rules regarding rights and basic protections of persons with acquired brain injuries, procedures for annual instruction on those rights, and procedures for hearing grievances and for the filing and resolution of complaints. The task force itself would consist of experts in the field of acquired brain injury, providers of services to persons with acquired brain injuries, persons who have themselves acquired brain injuries, and family members and advocates of those persons, as well as representatives of the Acquired Brain Injury Advisory Council. The task force is directed to report its findings and recommendations of the task force to this committee by January 2nd of 2022. Part A is where all the statutory changes are made to add acquired brain injury throughout the laws, providing rights and basic protections to persons with intellectual disabilities or autism. And that would accomplish the following. It's added as a definition, and it directs the commissioner to establish procedures for hearing grievances for persons with acquired brain injuries. It adds brain injury to the current chapter on the rights of persons with intellectual disabilities or autism. And to do that, it also adds a definition of the term. And so substantively, it adds to the provision of the chapter that it's the intent of the legislature to guarantee individual dignity, liberty, pursuit of happiness, and the protection of civil and legal rights, articulate those rights so that they may be exercised and protected for persons with acquired brain injuries, provides that such a person is entitled to rights and basic protections, provides that the legislature finds and declares that the rights of persons with brain injuries can be protected best under a system of services that operates according to the principles of normalization and full inclusion, establishes the right to appeal a decision regarding actions or inactions of the department that affects a person's life, provides that those rights and protections may not be waived by a guardian except as permitted by rule, and that some of the rights and basic protections of a person with an acquired brain injury includes dignity, privacy, and humane treatment, religious freedom, private communications, fair compensation, the ability to vote, possession and use of their own clothing, personal effects and money, nutritious food in adequate quantities, prompt and appropriate medical and dental care, and may not be sterilized, opportunities for behavioral and leisure time activities that include social interaction in the community and physical exercise. And it includes acquired brain injury and the guidance related to the delivery of services by providers in the department, including that persons with acquired brain injury have the same rights as all citizens, have the right to a community inclusion, are afforded real work for real pay, and services that would maximize a person's growth, development, control over their personal life, and promote a high quality of life. In terms of drafting notes, I'm just looking for a little bit of the intent around the bill. It appeared to me when I read through the testimony that with the legislation that was enacted in 2011, the department didn't adopt rules, and that was something that was a goal behind putting this legislation forward. And I may be mistaken about that, but from what I understood, that the task force may recommend rules, but it stops short of actually requiring the department to put rules in place. And it stops short of authorizing the committee to authorize any kind of legislation as a result of receiving the task force recommendations. So as drafted, there's nothing requiring the department to draft rules, and the committee wouldn't, it might have authority, I think, under the joint rule to report out legislation, but we typically like to put that authority in statute so that you automatically have a vehicle and you don't need to go through both chambers to get a committee bill. There is a question about private insurance and needs to be served by the waiver program. That question was submitted to the department. So if you had a question about that, perhaps someone is available. And the preliminary fiscal impact statement indicates an anticipated approximately $17,000 of general fund for anticipated increased legal costs. And I've linked here for your reference the legislation from 2011 that was referenced throughout the testimony and that I cited with regard to the drafting questions.
Are there any questions after going through that? Representative Meyer.
Thank you, Mr. Chair. Aaron, did the department respond to our request for information?
Very possible that I missed it in all the flurry of emails last night, but I don't remember seeing it. And so I don't know if Molly is available to perhaps.
She has just appeared.
Okay.
With magic.
Good timing.
Hello.
Welcome, Ms. Bogart.
Thank you. I believe the question was about whether private insurance would cover some of these services, and it is certainly possible. What I received back from OATS is that Maiden Care is the payer of last resort, and so if there's any other coverage, whether it's private insurance or VA coverage, other coverage like that, that would come before any Maiden Care coverage would kick in. And so if those services were covered, then they would be required to be paid for by those other payers.
Other questions? So any response from bill sponsor, Representative Hepler?
No, thank you, Mr. Chair. No, those are good questions about the, giving the committee the authority to report out a bill, and the task force, what Aaron's suggestion was also sounds like a good one, but you all have way more experience in this area than I do. So there are also, I will say, there are also people from the Disability Rights Maine folks, as well as people with experience in acquired brain injury who may want to weigh in. I think they're in the waiting room.
Mm-hmm. I don't see any hands up yet, but the folks in the waiting room are invited to put a hand up if you'd like to contribute to the conversation. So one of the frustrations I understand historically was that 2011 was supposed to put in place these changes, but they didn't happen as anticipated. Were there statutory changes made at that time, Aaron?
Yes, there were. They're in section 3089 primarily. And it talks about that to the extent possible within the limits of available resources, and except to the extent somebody might have a guardianship, the department shall protect the health and safety of that patient, ensure that they have access to treatment, individualized planning and services, and protect the patient's right to appeal decisions. And the department was directed to establish rules under that section.
But didn't, apparently.
Apparently did not.
Okay. So how do we get from statutory changes to rules in place? What can we do to make sure that that happens? Invite the department back to report on the rules? What's a good way to get that done?
Is that a question for me?
Yes, it is. Yes.
Okay. Well, typically we would put a directive in statute to adopt rules, and you can put an unallocated section establishing a date by which those rules should be adopted. In this case, where you have the task force recommending rules, you might want to consider directing the department to include in their consideration of the proposed rules, the recommended rules that the task force is proposing, just to link those pieces of the bill together. I know that that's a policy, ultimate policy decision, but it would seem to, then you wouldn't have a question hanging out there about what happens with task force recommendations.
Right. Other questions? And yeah, we would append the Perry amendment so that we would get a report back and an opportunity to write legislation. Okay. So I see we've been joined by Courtney McKellick. Have you got something you'd like to contribute to this conversation? Welcome.
Hi, thank you, Mr. Chair. I am an attorney with Disability Rights Maine, working with brain injured clients, and I had given testimony originally on this bill, but I just wanted to state that adopting those changes would be a good idea. Our expectation had been that the department would promulgate rules after the 2011 legislation, and we received information from them last year that they did not feel that they had that authority to do that. So if there's something explicitly, stating that, I think that would be helpful too. I can also answer any questions about the fiscal note if there are any. We don't believe that any additional expense is going to result, because most of these matters are resolved administratively and they don't involve the Attorney General's office litigating. But it's our position actually that this legislation might, because it's streamlining things, might actually save money. And certainly would not result in any additional expense because we're already handling these cases. The only issue is that there's not a clear and efficient framework for handling them. And so we're hoping that that issue is resolved by this bill. And the Acquired Brain Injury Advisory Council, of which I'm a member, is also willing to facilitate the task force, if that helps.
Well, that's good. Okay. Are there additional questions? I don't see any. Representative Meyer, you have a puzzled look.
That is not a puzzled look,
Okay.
but thank you for noticing. No, I would agree that we would add the language with regard to the department developing rules that are made in conjunction with the task force, the stakeholder group recommendations.
Okay. So at this point, I'd entertain a motion related to ILD 559. Senator Moore.
I would make the motion of ought to pass as amended on LD 559.
And I would second that.
And to be clear, there is a fiscal note reported, right? But we've heard testimony that may not apply. So we may end up as a committee deciding that doesn't apply and should be stripped out, but we can consider that with a language review. Is that correct, Erin?
I think you can consider that now, that you could direct that the department accomplish this within available resources. But I think as the flow chart that Luke presented at the very beginning of the year on his PowerPoint slide showed that if OFPR determines that there still might be an anticipated cost, a narrative portion would go on the bill and it would still go to the table. But you can, as a committee, say that you don't think it needs it, but it will end up on the table.
So that raises the issue. Is this count then as a study? Because it includes both a statutory change and a study. I don't want it to end up on this. I don't want it to end up on a
not the study table, the appropriations table.
With
it's not
some sort of verbiage from the committee that we don't feel that it should have a fiscal note.
Right.
And I can
Because
work with Luke with what that would look like, but my understanding is that if OFPR still believes that a fiscal note is required, it still goes to the appropriations table.
Oh, boy. So it's fair to assume we could do the statutory changes without a fiscal note, no question. Is that a reasonable summary?
My understanding from the preliminary fiscal impact statement is that those anticipated costs had to do with anticipated increased legal costs. And I think that that was anticipated because of the statutory changes.
Yeah, okay.
Not the task force piece.
Not the task force, okay. Representative Craven?
Mr. Chair, is the fiscal note one time?
No, it's,
No,
I think
because
it's
it hires a
ongoing.
person. It's
Um,
100,000 ongoing.
16, almost 17,000 ongoing.
Oh, I'm sorry.
I think that's a different bill. Senator.
It is. Sorry about that. All right. That's a lot. Okay. Any other questions? Yes, Representative Meyer.
Could you just clarify what the 16, I don't have the bill in front of me, I'm sorry. What is the $16,000 ongoing for?
Let me, can I share my screen in one second?
Yep.
Oh, yeah, it's peanuts. 17,000. There it is. Yep.
So ongoing general fund costs of approximately $17,000 for, the notes reflect it's for increased legal costs to the department due to an expected increase in litigation. Beyond that, I don't create the fiscal notes. So I don't know what all went into it. Luke would be the right person to flesh that out a little more.
That's too bad to have that on appropriations for $17,000. But we can make, we can work with them and make sure that they understand how high a priority is, or we can, yeah, that's the problem, because as soon as a fiscal note's attached, it goes to AFA. And our saying it doesn't need to go to AFA isn't enough. So I guess we have to consider the bill as it is, and the with a fiscal note attached, and then we can try and make the case that it doesn't have one, and call that to their attention, or shouldn't have one, and call that to their attention. Okay.
So you don't want to direct or indicate in some way at this stage that a fiscal note wouldn't be required, even though
I don't care. I don't care whether we do it at this stage or at language review, but yeah, it could be included right now off the bat.
Let's do that, and that way I don't have to remember down the road.
Let's do it that way then. I didn't understand the full ramifications. So let's do it that way. Yeah, let's raise it now and see what happens. So I'm sorry, I've lost track. There was an emotion? Yes, Ms. Dooley.
Right, so there was a motion on the table ought to pass as amended with the report back of legislation, I believe, and a direction to the department to adopt rules incorporating the task force recommendations. So the task force, I have a question about that. The task force is directed to submit a report by January of next year. Do you have a date by which you want the department to adopt rules by?
That's a question partly to the sponsor. Do you have a timeline for that?
Thank you, Mr. Chair. I do not, but you can put, like, sorry, it's afternoon. And I've been watching you guys all morning and it's been fantastic. I don't know if Courtney has an idea, or leave it in your expert hands. Obviously, it's an emergency bill, so the sooner the better. It's been sitting here since 2011. But I don't know what's reasonable. Maybe Molly has a suggestion.
Molly, do you have any thoughts about what's a reasonable time frame for getting back with rules?
I don't on this specific issue. We haven't talked about it with ODES. Generally, 6 months is helpful.
Okay.
July.
Well, that's not quite 6 months. Since we're in April now, that would be 10/1.
No, that would be 6 months after the task force submitted their report, which we're asking the department to incorporate.
Yeah.
And do you want those rules to be major substantive or routine technical?
Are you asking me?
I'm asking whoever has an answer because I can't decide.
I think I would say routine technical.
Yeah. They should fit in with rules that pretty much already exist for other scenarios, since we're adding just a couple of segments of language. So hopefully that shouldn't be a big deal to adopt. Is that a reasonable assumption, Molly?
Yes, yeah.
Yeah. Okay. All right. So the motion on the floor is ought to pass as amended. We've added a date for adoption that's into next year. Are there any other questions? So seeing none, we'll go to Ms. Withy for running the roll.
Representative Zager. Representative Zager is absent. Representative Lemlin.
Yes.
Representative Lemlin, yes. Representative Stover.
Yes.
Representative Stover, yes. Senator Baldacci.
Yes.
Senator Baldacci, yes. Representative Perry.
Yes.
Representative Perry, yes. Representative Griffin.
Yes.
Representative Griffin, yes. Representative Connor. Representative Connor is absent. Representative Craven.
Yes.
Representative Craven, yes. Representative Madigan.
Yes.
Representative Madigan, yes. Representative Javner. Representative Javner is absent. Senator Moore.
Yes.
Senator Moore, yes. Representative Meyer.
Yes.
Representative Meyer, yes. Senator Claxton.
Yes.
Senator Claxton, yes. That's 10 yes, 3 absent.
Okay. So I'll turn to Ms. Dooling and see, do you need anything else from the committee right now?
I know you're all tired, but we had amendment review scheduled on 5 bills. If you want to proceed with that.
Okay.
Sorry.
Do you think this can be accomplished in a modest time frame?
Yes, I sure hope so.
That's what me too.
Okay, I'm going to share my screen if that's okay. And these were sent to you yesterday as well. So this is a minority amendment on LD 624, which amends the provisions around service preparation or consumption or food or drink in tobacco specialty stores, which are one place where smoking is still prohibited. I mean, still permitted, not prohibited. So this amendment provides that on-premises services preparation or consumption of food or drink, except the on-premises consumption of water, would be permitted in a tobacco specialty store. Although this language at the bottom here is underlined, that was because it was just easier to strip out the language and add it back in, but this language underlined in the bottom part is identical to the underlying bill. So the only change is about the on-premises consumption of water from the underlying bill.
That looks good. Thank you.
Sorry, it gets confusing to keep changing screens. Okay, this is LD 450, which was originally titled an act to promote the education of patients by primary care and urgent care physicians regarding bone marrow transplant list. You've broadened the focus, so I've changed the bill title, and you can tell me if you don't like it. Resolved increase public awareness regarding bone marrow donation, and it directs the department to post to its website informational and educational materials, including a downloadable pamphlet regarding donation to the bone marrow program, and that it directs the department not to develop new materials, but to obtain those materials from a source that has provided those materials for public use. And I think this was a unanimous committee report.
So I'm looking for the bill sponsor and asking if that sounds okay to you, Representative Craven.
Yeah, that sounds fine. Thank you.
Good.
Okay. Let's see. This was originally titled an act to restore the Maine Center for Disease Control and Prevention Cystic Fibrosis Assistance Program. And based on the changes of the committee, I've now retitled it, if this title is okay with you, resolved to direct the Department of Health and Human Services to review the needs of persons with low incidence health conditions. It strikes everything in the bill relating to cystic fibrosis, the funding program that it had proposed, and instead proposes a resolve to direct the department to review the needs of persons with low incidence health conditions by identifying what those conditions are, which ones require services and supports, and what the scope of those needs may be, which ones are or are not currently funded through the Special Health Needs Program within the department CDC program, our department, and describe the unmet needs of those persons, and then develop a plan to address the unmet needs described that the task force found to improve the ability of children with special needs. The ability of the children with special needs program within the CDC to meet those needs. And it directs the department to submit its findings and recommendations to this committee by January 15th of next year. And it authorizes this committee to report out legislation. This was a unanimous report.
That raises for me the question about whether we want to add a reference to the Rare Disease Advisory Council and who they should be working with.
We can't do that because we can't assume that any other legislation has passed. And so when we draft with the current state of everything. It's possible that if the Rare Disease Advisory Council were to be enacted first, you could add a cross-reference to this bill later on. But unless you wanted to insert all of the language from LD 972, which is possible, I think that's possible because it was a bill, not a resolve. Then it doesn't exist in this, and we have like blinders on when we draft.
What do people think about that idea? It's another layer of complication. Senator Moore?
I think we just need to leave it alone personally.
We'll trust the department to find the rare disease.
Yes, I second Senator Moore's comment.
Okay. All right. So yes, the answer to your question is Aaron, the prior version looks fine.
Great. We have two.
The chair was in error.
Two more. Sorry. LD 590 is an act to require a main care coverage for ostomy equipment. This directs the department, which they're already doing, but we needed to ground it in statute somewhere in order to direct the rulemaking change, to provide coverage for ostomy equipment and supplies when they've been prescribed or recommended by a healthcare practitioner, which was a change that the committee had made, that previously it had said physician. And so the term healthcare practitioner includes a broad array of providers. I mean, obviously they'd be working within the their licensure. But if those people are authorized to prescribe or recommend that equipment, then the department needs to cover the equipment. The department's directed to adopt routine technical rules to implement this section. And that directive is in section 2, which provides by January 1 of next year, the department should amend its rules to make sure that ostomy equipment and supplies are reimbursed at no less than 85% of the 2021 federal Medicare reimbursement rate. In talking about this with Luke, he did note that some of the 2021 federal Medicare reimbursement rates were in fact lower than I think the 2011 federal Medicare reimbursement rates that the current reimbursement is based on. And so this language here, as long as the rate is no lower than the rate reimbursed by the department as of January 1, 2021, is intended to set the floor on those rates. So rates currently covered would not decrease from where they are now. And if they are increased under the federal Medicare rate from 2021, then they will increase. Because my understanding was that the committee wasn't intending to lower reimbursement rates, but so for those that would be lowered, we've set the floor. The fiscal note is here. It shows approximately $9,300 in general fund expenditures to cover the 85% of the federal Medicare rate. And you had a question about, I'm just going to share my screen again, what it would cost if it wasn't 85%, but whether it was 100% of the federal 2021 federal Medicare rate, and it would, for the first 6 months of 2022, increase that to approximately 60,000 of general fund, and for 22-23, it would increase it from about 18,000 to about 121,000.
Yep. Go ahead. Any comments based on that? Let it go as it is. We've accomplished something for the folks who have to use ostomy supplies. Okay. Okay, we're good.
All right, last one.
Yep.
This is LD 121, which you may have seen before because this was one of the bills that was reviewed in the Judiciary Committee because the bill involved, I'm just scrolling to where the bill was, background checks, and certain background check provisions need to be kept confidential, and that triggers the judiciary review. It looks like you made one change. You changed may to must. And so scrolling back up, you can see lines 11 through 13 are those changes made through changing may to must. The appropriation section, I understand from Anna's notes at the top, are the same, exactly the same in the original bill, and you had that information before you at the work session. So there's nothing new here with the appropriation section. That's all I have for you.
Any comments? Everybody okay with that? All right. Any other any other business to come before the committee, Ms. Dooley?
Not today, Senator.
Hey, we haven't seen your cat today, but we're going to wrap up early. That being the case, I would invite the chairs and leads and Ms. Dooley to join us for a brief scheduling session to make sure we're all on the same pages on the next several weeks. So thank you all for being here. Thank you for your hard work, and enjoy a long weekend. Take care all.
Bye.